Sa host po, nandito na po si Ma'am Therese. Si Mami nandiyan na, pa-host po, pa-co-host po. Thank you.
Aldrich, ikaw yan?
Yes, Mami, morning po.
Morning. Okay ka na sa meeting mo?
Opo.
Okay. So, I have more than 500 participants, right? Can you
Opo.
just give me a profile para more or less meron akong idea? Schools.
Opo. Mami, wait lang po. Mag-introduce lang po muna sila. May program po saglit.
Okay. Di mo naman sinabi sa akin talaga. Sige.
Sige po, Mami.
Meron pala tayong program. Okay.
Opo. Thank you po.
Welcome. Who will assist me, Aldrich?
Si Ma'am Feds po, andito po din siya sa loob.
Si Feds. Okay.
Opo.
Heavenly Father, we come to you today with humble hearts, seeking your guidance and wisdom as we begin this program. Lord, we ask that you would bless every person who has gathered here today, and that you would be present with us in a special way. We pray that this program would be a time of learning, growth, and fellowship for all of us. Help us to listen to one another with open hearts and open minds, and to support one another as we strive to serve you in all that we do. Please give us the strength and the courage to follow your will and to use the gifts and talents you have given us to make a positive difference in the world. We pray all of this in your holy name. Amen.
Mga kababayan, ang pambansang awit ng Pilipinas. Hayang magiliw, helas ng silanganan, alam ng puso, sa dibdib mo'y buhay. Lumang hinilang, tuyagan ng magiting, sa manlulupin, di ka pasisigil, sa nagatang tulong sa simoy at sa langit ng bagaw, ay nilagang tulakaw, sa pagkayang minamahal, ang islang ng matawad mo'y tagumpay na nagkikinig, ang bituin at araw niya kailan pa may magkikinig, luman ang araw ng walhagin pagsinta, buhay ay langit sa piling mo, ang ibigaya ng pagkay ng akin, ang mamatay ng dahil sa'yo.
Of different schools we start, with a single name in a part. The clash of battle is sweet to hear. Right now when victory is near, excellence is our only standard to outshine the rest. With a great mind and compassionate heart, our home that trained us to be the best we can be. All that we learned at Top Prof Review Academy, we shout with pride and hands up high as victors our dreams shall soar to the sky. The trained us to be the best we can be. Soar to the sky. We learn that if you want the top of you can soar to the sky.
Our guest speaker today is a nurse midwife who graduated from the University of the Philippines Basic Nursing Program. She holds a Doctor of Nursing Administration degree. She is the first nurse who attained the Level 5 Maternal and Child Nurse Certification Program and also an ANSA PRC BON CPD evaluator at the Level 5 Nurse Manager Certification Program. She is a resource person for the MCNAP BON-DOH Birthing Module Initiative. She has previously worked at Josefa Bella Memorial Hospital as the chief nurse. She previously served as the former principal of the Josefa Bella Memorial Hospital School of Midwifery. She is the proponent of Unang Yakap and board director of Blessed Tetada Kangaroo Mother Care Nurses all over the country. She also works as an IE and suturing trainer for midwives and nurses. She specializes in obstetric nursing and latest trends in the nursing practice. Let us give our full attention to our guest speaker, who is the nurse leader of the country's largest maternal specialty hospital, making her an expert in her own right, Dr. Mary Therese Pacabis. Good morning, Doc.
Hello, good morning. Can you hear me?
Yes,
Okay.
Doc.
Yes po, ma'am. Good
Okay.
morning po.
So, this is Ian and Feds, tama?
Yes,
Tama?
po.
Yes
Okay.
po.
So you are my assistant for this morning. Alam nyo naman, no, I'm not very techy. So I might need to ask you every now and then if I get out of the screen or something else. So thank you for assisting. So can you just give me a profile of today's class or today's group? Profile lang iya. When I say profile, I'm talking about schools, generally, kahit ano lang, a few schools, mention nyo lang.
Sure po. We have students here from NU Manila, Gordon College,
Okay,
LPU or Lyceum of the Philippines University,
okay, okay.
Olfu, Our Lady of Fatima University,
Yes, okay.
PLM po.
I'm sorry,
Allow.
Palawan State
Yes,
University,
okay. I reviewed their midwives there. Sige.
mhm,
Mhm.
Emilio Aguinaldo College,
Okay.
Southwestern University,
Yeah.
University of Pangasinan,
Oh, sir, Yupang, syempre.
yes
Mhm.
po, Philippine Rehabilitation Institute,
Okay.
AUF or in Pampanga,
Mhm. Madami yata yan eh, no?
yes
More or
po,
less. I can see 641 in my participants. Tama ako?
yes po. We also have also in University of Cagayan Valley,
Oh, pero they are here, ha?
yes po.
Okay, okay.
Mhm. We also have in PLM,
Mhm.
USLT,
Mhm.
UP, meron din po tayo.
Mhm.
Brokenshire College, Davao. Don Mariano Marcos. Arellano University, Arroyo University, University of St. Mary's, BPSU, Far Eastern University, Trinity University of Asia,
Mhm.
Samar State University,
Yeah. Okay na.
yes po.
O si Aldrich, okay. Ganito lang, no? Okay, so this is just one thing that I would ask of you, no? Alam niyo naman, we are not in a face-to-face forum and I miss that, no? I miss it because you know very well how I love to interact with my graduates, no? Or with my class. Now, there are times when I need to ask things, I need to verify things so that I will know whether to go further or to just pass through. Kasi kung alam na nila, if I can see that more or less it's already a mastery, hindi na kailangan lumalim. So I will just pass through. But there are times in other classes that I can see that they need further you know, they need further explanation or they need further information. So, pag tinanong ko lang, Aldrich, paano ko sasagutin? Yun lang, ayoko makipag-usap sa ano, sa computer lang. So, how do I get their feedback? Whether they are getting what I'm saying, whether I'm communicating or what. So, ano ang ano mo? Ian and Feds and Aldrich, ano yan? Kayo nang sasagot.
Opo, ma'am, pag may ano, sa pwede naman po. Through
Okay.
hintayin lang po namin yung feedback nila sa group chat, then
Okay.
i-raise po namin sa
Okay.
inyo.
Okay, fair enough. Okay, so can we start? Okay. So, good morning, class. Good morning. I'm very glad to be here. Again, I'm excited, Aldrich. Kailan ba tayo mag-face-to-face? I don't know if by next season we will go on face-to-face. Sabi ni Roland, mukhang madami na kayo. Hindi ko alam kung 25 na ba ang inyong branches na ano. And then sabi niya, Mami, baka mahirapan ang icons. Oo nga, kasi mga senior na kami. Okay, so I don't know what you have in mind. I think you are doing a strat plan on this, concern, di ba? Pero as much as possible, I would like to be really in front of everything para makontrol ko ang class. At any rate, I will do the best I can through this forum, virtual. We've had this already for several times in the past. Mukha namang successful as long as they focus. Okay? So, my first session sa icons usually is information and review. So, when I say information, my dear ladies and gentlemen, or my dear graduates, I am going to inform you on the updates in maternal and child health, no? Being affiliated with the Department of Health. Okay, so I will be informing you of the latest. However, I will also be reviewing the basic concepts, which I know you know, but remember sa review it is mastery of the subject matter. Hindi na ito yung beginning knowledge. So I'm sure all of you must have passed already the concepts and topics that I'm going to discuss, but I believe that this is very, very important. And usually this is the framework, or this is the pillar, no, the pillar concepts of maternal and child nursing examination. Okay, now there will be times that I might be overlapping with pediatrics because remember, mother and child. But don't worry, ang pakikialaman ko lang yung babies or the newborn, because definitely the first person that the baby sees, no, upon birth or at birth is the person, the skilled birth attendant who attended to that baby or to that delivery. And definitely that is either the nurse, the midwife, or the doctor. And generally, pag skilled birth attendant yan, usually it's the maternal nurse. Yung pediatric nurse, we'll talk about that later when I talk about the areas of specialization in nursing practice. Okay? And so with that, Aldrich, can I share my screen?
Yes po.
Okay. Naka-screen na ako. Sige, tignan natin ha. Screen share. Okay. There. Ba't nawala?
Kita na po,
Ah.
ma'am, yung share screen natin.
Bakit ako bumalik sa ano? Bakit ako bumalik sa... kita na?
Yes po, ma'am. Maternity nursing review notes.
My dear, let me go back to that. Bakit ako nawala? Where do I go? Back to meeting?
Pa-double click po yung screen po natin, Doc.
Double. Yan. Yun ang sinasabi ko. Double click. Ayaw pa rin. Sandali ha. Nawala ako. Ayun. Ayun na. Ayun, nakita ko na. Pero narito yung, alam mo yun, yung beginning ng ano. Okay. Let me see. Let me play with it ha. That's why I need people around. Okay, new share. Nakikita na. Is it full? Hindi naman. So that I can go into the full screen sharing. Iyan, kita ko na siya, pero may mga back to meeting, join, schedule, share screen pa ako. What do I do?
Pa-click na lang po nung sa slideshow po.
Click sa slideshow. PowerPoint. Ayun. And then click sa slideshow. Or, nakikita nyo na? Kita ko na. Okay.
Ayan po, clear na po.
My dear, bakit hindi maalis-alis yung ano dito? Yung maliit na ano? I will remove the subtitles. Okay. Can you see?
Yes, Doc.
Bakit ako meron ditong maliit na screen? Ganun lang yun?
Makikita. Apo. Pero sa side naman po namin, clear naman po, Doc.
On your side. So okay lang sa side ko.
Yes
Kasi
po.
if I click stop share, baka mawala to, no? Right?
Yes po.
Okay. So we shall start, no? So as I said, this is a bit of a review of the basic concepts. Bear with me, ask questions. But then I'm going also to give you the latest information in maternal and child health based on DOH updates. So my source for the information will be DOH, and the DOH source is definitely the World Health Organization. So the things that I will be discussing, some of the information and updates that I will be discussing will not be seen in your books. But at times in the board exam, the examiners would want to know how updated you are. Okay? And so this will be a good assist in your review. Okay? So, kana ko. Ayan. So can you see the framework of maternity nursing? Now, please take note, maternity nursing here is only in the Philippine setting. Although, if you go global, these are the things or areas where the maternity nurse can practice. Choose your area. But generally, in the first 2 years or in the first year of practice, no, in any healthcare setting, whether it's in the clinics or whether it's in the hospital, especially in the hospital, these are the areas where the nurse can practice. Maternity nurse. Ito yan. So let me go into this, no? So first, if you are a maternity nurse, definitely, no, you have to be competent in the practice of antenatal care. Okay. Now, maternity nursing or maternal and child health nursing is under the kingdom of obstetrics, the science of obstetrics, the medical practice of obstetrics. And definitely, when we talk of obstetrics, it is always associated or it is equivalent to childbearing. So pag sinabi nating OB, automatic yan, ang nasa isip nyo na pagbubuntis. Walang OB na walang buntisan. Take note of that. Okay? Whether that pregnancy progresses into a full-blown pregnancy or whether that pregnancy terminates, basta nabuntis yan. That's obstetrics. So, the maternity nurse must be adept at giving or providing antenatal care. Okay? So, antenatal care is the first area. But in my hospital, having been the chief nurse for several years, more than a decade, no, I cannot put my nurses progressively in these areas. Kasi if you're going to follow the sequence, dapat yan, prenatal labor, postpartum child, ganon. Hindi naman pwede yun. Kasi if I have 400 to 500 nurses, I cannot put them all in one area. So, what I do is, sinasabog ko lang sila. Ideally, they should start with this, but I can also assign them sa labor, sa pediatrics ward, sa NICU, women's health, etc., etc. Okay? Now, if you are maternity nurse again, you have to know the basics and the standards of providing antenatal care. We will discuss that later. And in the exam or in the post-test that I think I gave you earlier, some of the questions are integrated. The antenatal care is integrated in that. And I'm going to discuss that specifically as we go into questions. Okay? Now, the next area, okay, so this is the longest. No, this is the longest phase, PHASE, of obstetrics, of maternity nursing. This is where you see the woman for ideally 9 months, automatically 9 months. That is if the woman is very consistent. However, let us look at the culture of the Filipinos. Remember, sinasabi ko dito, framework of maternity nursing in the Philippine setting. So the Filipino woman, by the way, when we talk of the Filipino woman, I am talking of the common masa. Yung mga babaeng generally nasa laylayan ng society. I'm sorry to have to mention this because these are our clients generally if you go to the Department of Health. Okay? Now, those who can afford the private JCI hospitals accredited, no? JCI hospitals, then they get the best of care. And sometimes, eto na ha, I will tell you, sometimes the clients in these hospitals, no? Ito sina Ayala, Sobel, Villar, C, etc., etc. Sometimes they choose their skilled birth attendants. No? They do not usually ask the nurse or the midwife to attend to them. They usually would demand the doctors to attend to them because ang ano nila, ang kanilang concept is binabayaran ko yung doktor na ito. So generally in medical private hospitals, the maternity nurse can be the assistant. Mag-a-assist lang siya. But in the latest UHC, Universal Healthcare proposition, okay, of the Department of Health, no? Once implemented, everybody now, except of those that can afford, will have to pass through the primary care setting at the community level. And generally, it is the nurse or the midwife who is at the front line. Okay? So, antenatal care. Yung mga Pilipino, I'm talking now of culture, yung mga clients namin sa Fabella noon, hindi sila masigasig magpa-check up. You know the culture of Filipinos, kahit naman kayo, no? You don't go for check up only for preventive reasons. You only go for check up if you feel something. Marami kaming cases, pumupunta sa amin kasi dinudugo na. Hindi yung pupunta sa amin kasi may nararamdaman, nagka-cramping pains. No, they come to us when we need to manage or treat them already. Wala na yung preventive. Okay? So, the nurse must be adept at assessing, no, immediately the immediate needs or the emergency needs of these patients. So, 9 months sana ha, tayo. Now, you can also be assigned at the labor and delivery room, providing labor and delivery care. And my dear nurses, this is the most critical area. Yung mga linalagay ko dito na nurses are the nurses whom I have assessed, whom I have seen na medyo angat ang performance. When I say angat ang performance, not necessarily marunong or matalino. I do not need magna cum laudes or summa cum laudes in my delivery room. What I need are nurses with a presence of mind with a quick sense of instinctual sense, no? At saka yung mabilis mag-assess with a very good clinical eye. In my decades of practice as a nurse, hindi lang naman sa maternity nursing, but as a nurse, no, it does not need it does not need a Latin merit to have all this. Any nurse who passes the board exam can develop these skills. Any nurse who has a license because of her intensified learning, her desire to improve herself, can become a very, very good nurse. So in the labor and delivery care, ang linalagay ko dito, yung mga mabilis mag-action, kasi may mga nurses din ako, sorry ha, may mga nurses din akong napakabagal. So yung mga napakabagal na nurses, nakikita ko ha, yung mga talagang one at a time lang, na kailangan mag-sequence, dun muna sila sa periphery because in the labor and delivery room, you need action. You need instinctual action and you need the competence. Okay? Remember, in obstetrics, accordingly, statistics. I've seen deaths, maternal deaths happening. So yung mga namatay during my time were generally at the labor room and generally at the delivery room. Okay? So antenatal care kasi for as long as that woman is consistently coming to us per check-up, naaagapan. And another area is the postpartum care. Now, among the three phases in obstetrics, okay, this has the mildest. This has the mildest care to provide for because you're just assisting the woman to return to her pre-gravid functions and to return to her pre-gravid state. Okay? But there are still skills that you should perform. So, dito, araw na lang to, no? So, dito, months, dito, hours. No labor should go beyond 24 hours. Please take note of that. After 24 hours at hindi pa nanganak ang isang babae, my dear nurses, that is already an alert sign. Example, sa akin nun, 6 to 2 kami nun. I received a patient at 6 a.m. upon my time in. Pagdating ng next day, siya pa rin ay naroon, then definitely my focus will be on this woman kasi what is she still doing at this time in the delivery room or in the labor room? And so, nakafocus na ako doon. Anong problema? What can I do? Okay? And I will definitely look at the orders because definitely ang record nito, puno na yan ng order. Marami ng contraptions na nakakabit sa kanya. And then sa postpartum care, the woman stays here or the woman can have a 24-hour postpartum lang. We discharge after 24 hours for normal cases. We discharge after 3 days for cesarean section. That is now the standard operating policy in all hospitals or in all healthcare facilities. Kahit sa lying in. In fact, abroad, my dears, manganganak sa umaga, uuwi sa hapon. So normal delivery in some states, no, in some tawag nito progressive countries, ano na lang yan, outpatient basis na siya. Okay? Para na lang siyang nag-gastroscopy, para na lang siyang nag-colonoscopy, etc., etc. DNC is already being done on an outpatient basis. So if after 2 hours the woman is okay, then they discharge the patient. Okay? So ayan. Now, so these are the maternal areas. Please take note that you have another area for the maternity nurse kasi maternal and child health tayo. And this is the provision of child care or child health. Pero kasi we already have this specialty, the subspecialty of pediatric nursing. So when will the pediatric nurse begin? And when will the maternity nurse, the maternal and child nurse end? So kailan nag-i-stop si MCN at kailan nag-uumpisa si pediatric? Okay, so generally this is what we do. For as long as that baby, number 1, is in the delivery room, maternity yan. Because the pediatric nurse cannot deliver. Okay, so maternity yan. For as long as the baby is normal, maternity pa rin yan. Clear? So nasa DR kami, as soon as I deliver the baby and I assess that that baby is normal, ako pa rin yan. Until sa postpartum area. However, as soon as I deliver the baby and I assess through my skills that this baby is at risk, then I call the pediatric nurse to take over, resuscitate, although I also resuscitate babies ha. Kasi pag na-assess natin yan at risk or highly abnormal, then immediately I would cut the cord and go to the resuscitation area and resuscitate the baby while waiting for the pediatric nurse to take over. Once the pediatric nurse comes over, specialist to no? Pediatric NICU nurse to. The NICU nurse takes over and then takes the baby to the ICU after resuscitation. So tapos na ang kingdom ni MCM. Okay? So yun siya. So now, kung okay naman yan, up until ang usapan namin, up until na-discharge yung mother and baby dyad na normal, MCN pa rin. But once this baby, okay, visits, okay, for her well baby clinic visits, pedya na rin yan. Kung merong pediatric nurse. Kung walang pediatric nurse, then maternity pa rin. Okay? Remember, we have shortage of nurses now. So the nurse must be what? A generalist, aside from her specialty. Okay? So the nurse now here in childcare provides for all the needs of the baby. Please take note, ha? Take note. Okay? The board examiners are very, very steadfast in the rule of breastfeeding, okay, and vaccines. You should master that. Walang exam na hindi nagtatanong ng mga ito. 1 or 2 easy questions on breastfeeding and vaccines. Hindi nawawala yan. And at this point, may I tell you that the maternity nurse, the maternal and child health nurse, has 3 advocacies. 3 advocacies. Okay? The first advocacy of the maternity nurse is what? Planning pregnancies. So reproductive health or family planning. If you are not an advocate of this, you might not be comfortable in becoming a maternity nurse. The next advocacy is breastfeeding. And the third advocacy is immunization. Okay? So ito yung 3 advocacies ng maternity or maternal and child health nurses. So at the forefront all the time, nagbre-breastfeeding information, nag-attach kami, nag-a-assist kami for breastfeeding to succeed, nagva-vaccine kami for newborn babies. Okay, we also do vaccine for babies who come to us na walang pediatric nurse, etc. And we provide family planning services. We provide family planning services. Again, it is all this will be due to your certificates that you accumulate in your first year of practice. Okay? Then of course, this one is the least, no? Ito, women's health is the least area of practice ng maternity nurse. So, sa women's health clinics, generally, the nurse assists the doctors. But if you are an independent nurse practitioner in the community setting, ikaw ang haharap sa mga problema ng mga babae na hindi buntis. Because women's health is the area of practice of what? Taking note and monitoring the reproductive health of non-pregnant women. So, traditionally, ang tawag dito is gynecology. Okay? So, traditionally, ang tawag nila dito is gynecology. Okay? Pero ngayon, gynecology is very traditional and very specific. Now, women's health has expanded to include reproductive health due to a certain legal basis, which we will discuss later. So, sa women's health, although women's health yan, if you're going to look at women's health, this will be part and parcel of the total package of reproductive health, which will include the man or the partner. Okay? So, kasama na yan. So kasama sa women's health later on that we will be discussing is infertility. Yung mga babaeng hindi mabuntis-buntis. And when we look at this or when we manage women, no, with infertile problems, kasama si lalaki, yung partner. Pati sa family planning, generally, okay, we should ask the partner to be with the woman when we provide services or when we counsel the woman for family planning. However, no, if there is a conflict between the woman and her partner. The woman's choice, the woman's decision is the most significant and is upheld. Kaya lang, sabi ko nga, ganun naman pala bakit pala pa natin sinasama yung mga lalaking ayaw yung mga asawa nilang mag-planning yung mga misis. Ang sagot naman ng mga experts, which I agree, is to keep peace in the relationship. Walang taguan. At saka to be able to get the involvement, the engagement, and the cooperation of the partner. Alam nyo, useless ang methods kung hindi naman magko-cooperate si partner. Okay? So we'll be talking about that more later. Okay? So this is in totality the areas of practice of maternity nursing, maternal and child nursing in the Philippine setting. Okay? Iyan, clear ba yon, ha?
Yes po, Doc.
Very good. Pwede ka nang mag-lecture later kasi you are very, very intent in listening.
Yes
Okay.
po.
Okay. So next will be antenatal care. So let's discuss briefly what antenatal care is. So antenatal care is the care of a woman who is pregnant. And pregnancy means the egg uniting with the sperm. Okay? Yan ang sabi, ha? When they say that the woman is pregnant, kung nag-fertilize yung egg ng woman with the sperm of the man. Alam nyo yan. It's a reproductive process. However, alam nyo ba that the latest now in the global, let me define. When I say global community, I'm talking of the developed countries, the industrialized countries, the countries that would dictate the practice of science. No? O say, alam nyo ba that the family planning international organizations in Geneva, their home base is generally Geneva, Switzerland. No? Usually, merong mga advocates na they would want to more or less redefine pregnancy or what we call this, redefine is or be more specific about the definition of pregnancy. Okay? Ano yun and how? Okay. So, there are some advocates now, there are some groups that would like to redefine pregnancy as hindi sa fertilization because our general definition is pregnancy begins with fertilization. Alam nyo, may mga advocates na in the global community, okay, for some years now, had been advocating na palitan ang definition ng pregnancy that should begin with implantation. Can you get me? Girls and ladies and gentlemen, can you get me? So gusto nilang palitan na ang beginning of pregnancy is sa implantation, hindi sa fertilization. Pero alam niyo naman the church, all churches, most churches are very, very, what we call this, very, very strong about this. Ayaw nilang pumayag. Kasi ang sabi ng mga advocates na iba, if pregnancy is defined as, the beginning of pregnancy is defined as during implantation, then any termination of pregnancy from fertilization to implantation can be acceptable. Hindi na siya magiging controversial. Kasi hindi pa naman buntis Nagets niyo ang point? Okay. Again, very, very strong ang tawag ito, ang voice ng Catholic Church specifically. Why change the definition? So start pa rin ng fertilization. Okay, we can discuss more about that later. Okay. And pregnancy is considered to be the longest phase in obstetrics. So if you notice, naka-enclose parenthesis ako ng fertilization. Kasi I would like to emphasize that pregnancy begins during fertilization. Okay? Now, it's the longest phase in obstetrics. Ang haba nito. And so let us more or less look at the phases. 280 days average, from 270 to 290. Okay? In weeks, this is what we use in clinical practice, 40 weeks average, and that would be the minimum of 37 weeks to 42 weeks, our range. So that means to say below 37 is preterm and above 42 is postterm. Now, of course, 40 weeks is the standard average, but the latest now, based on EBP or evidence-based practice, is according to practitioners, the best time to deliver a term baby is not 40 weeks, but between 38 to 39 weeks. Yun daw ang pinakamaganda, pinaka-ideal. So why am I mentioning this? Kasi sa practice, doctors do not anymore wait for 40 weeks to induce labor or to induct labor. But when they feel or they believe na kailangang ilabas ang bata, okay, then they do it if everything is okay with the test of the fetus. The BPI, the biophysical profile is okay. The amniocentesis is okay. The non-stress test is okay. So the baby is perfectly normal. And they need to induce the baby, they need to induce labor, sorry. So they choose the weeks of 38 to 39 weeks. Okay? So yan ngayon ang practice na ginagawa. And this is also advocated by WHO. So eto na. Okay, next. 9 calendar months. Now, 9, please take note ha. We place here the calendar. Kasi pagdating dito, you have the lunar. Now, definitely, parehong months siya. Yung isa calendar lang, yung isa lunar. And take note, the lunar has 10. The lunar has more than the number of calendar months. Why? Kasi ang lunar months depends on 7 days a week, eksakto, regardless of months. Whereas the calendar months has what? 128 month na days, 128 days na isang buwan. Tapos, 4 na 30 days na buwan, the rest are 31. So sa calendar months, uka-uka. Whereas sa lunar months, is straight. So sa lunar months, ang isang buwan nila has 7 weeks, has 7 days per week. So 28 days ang isang quote-unquote buwan nila. And so, mas specific ang lunar months sa calendar months. Tapos tatanungin nyo, ma'am, bakit pa kasi ginawa yan? We do or we talk about calendar months for our lay clients. Hindi kasi maintindihan ng ating lay clients ang lunar. So we have to show them the calendar and say, Mrs., eto, manganganak ka sa October ganito. So ang mindset ng ating mga clients would always be the calendar. And remember, the Nagel's rule is based on calendar months. And the Nagel's rule is used for the purpose of your client who is a layperson. Okay? Yung lunar months, ito, most of the calculations, fetal growth and development, as well as your Hayes rule in determining, tawag nito, the length of the fetus is always based on lunar months. Okay? So longest phase is pregnancy. Now, sa prenatal care, okay, significant in the outcome of pregnancy. So, prenatal care is considered to be one of the most significant in the success, okay, or in the outcome of pregnancy. What do I mean by this? Tandaan nyo ito, kasi this is what I did also in practice. This has been the standard since time immemorial. So, nung ako'y nasa ER ng Fabelia, pag may dumating na, aside from the questions that I usually would ask is, Mrs., nagpa-prenatal ka ba? Okay? Now, if the answer of my client, of our patient who is seeking admission is, Ma'am, hindi po, that will now ring a bell in our minds. Mind ko, mind ng doktor. And I tell my doctor, Doktora, walang prenatal. Why? Because that means to say, any problem, any concern might not have been addressed. So, doon pa lang sa ER namin, when the woman comes to us with labor pains, na walang prenatal care, doon pa lang kami gagawa ng, how do I call it, more intensive assessment. And that will waste our time. So we consider women without prenatal checkup as a possible risk pregnancy. Okay? Kasi we never know what to expect. Clear? So pag walang prenatal checkup, at risk yung pregnancy na yan. And so if this woman comes to you in your birthing clinic, in the community, kasi ganito the DOH has an administrative order. Ano yun? Take note please, my dear nurses, that the DOH has an administrative order that discourages, no? Skilled birth attendants, non-medical, yung midwife at nurse, na huwag magpaanak ng primary at saka grabida 5 and above sa community level. Take note pag ikaw na sa community level and you are a nurse or a midwife, the DOH discourages no, na magpaanak ka ng grabida 1 o grabida 5 and above. Grabida 1, you never know what to expect. Okay? You never know what to expect. Okay? Even if that woman had a perfect prenatal, wala kayong nakita, etc., etc., my dear, is still the most significant is the labor delivery phase. Hindi mo malalaman kung anong mangyayari sa labor delivery. That's why one important mantra of the skilled birth of the DOH WHO now is tawag dito that all women at childbirth are at risk. Clear? Hindi mo masasabi kahit napaka-perfect. And that's the reason why wag muna kayong mag-attend ng prenatal. What can be a problem sa prenatal ng mga primary? Number 1 is dystocia. Mahihirap ang mga anak yan. And the dystocia can be based on 3 factors. It can be the power, it can be the passage, it can be the passenger. Hindi mo masasabi. Okay? And what is the problem with grabida 5 and above? Di atony. Anong ibig sabihin ng atony? Magble-bleed ang mother because that uterus has been overstretched for more than 4 times. Kasi ideally, I remember when in my early years of teaching or reviewing, ang recommended na parity lang is 2 to 4, 2, 3 and 4. Kasi those are the what do you call this? The parity na pwede pang bumalik yung myometrium into its normal status. But once nag 5 and above ka na, considered overstretched na ang uterus, that uterus will have a difficult time returning to normal. Okay? So what can happen is mag-bleed ang nanay. And the primary care setting is not ready, is not prepared. Kahit BMOC yan, kailangan isimok mo siya. We'll talk about that later. Are we okay? Iyan, okay ba yung mga bata?
Yes po, Doc.
Okay, walang question so far?
So far, wala pa naman po.
Very good. Okay. Sige, I go back, So, let me go back, no? Sa next slide ko. Bakit ganito? Ay! Ayan. Nawala. Okay, let's go to labor and delivery phase. No, this is, I earlier said that this is the shortest phase in OB. Okay, and I emphasize that it should not be more than 24 hours. Remember that obstetrics later on, we will discuss this as a time frame. Ako, nabuhay ako sa practice ko na may time frame. Okay? And that complications in childbirth generally occur at this point. Okay? Then, okay, therefore, the crucial, naririnig nyo ba yung aso? Anak ng pusikat. Okay. So, basta clear ang aking voice ha. Therefore, there are expected crucial competencies of the maternal and child health nurse, which is very, very important in labor. What are these? The use of the partograph. Okay. Performing vaginal exams. Performing normal spontaneous deliveries. Suturing lacerations. And vaginal examinations. Now, if you look at this, my dears, if you notice, ato gusto ko lang malaman. Iyan, please, graduates, please, can you just tell me through your chat, no, if you have been exposed in performing this? If not, alin dyan ang hindi nyo ginawa? Sige, please, I need that so I know how to go further. Ian, please.
Most of their answers po are suturing lacerations po.
Okay. So, suturing lacerations ang hindi pa nila nagagawa. Tama? Meron pang iba?
Yes po, yun po ang karamihan sagot po.
What about the rest? Ano yung mga ibang hindi karamihan?
Use of partograph.
Oh, ano pa?
And vaginal examination.
Okay. Okay. So, okay. My dear graduates, ito na ha. Apparently, based on your chats, no, na sinabi sa akin, there is only one competency, not competency, there is only one thing that you did in the delivery room and in the labor room, no? NSD. Lahat kayo. Because this is required by PRC. Kaya talagang nag-handle kayo. Hopefully ha, kasi in one of my questions in the post-test, I asked about the delivery process and we will go into the process itself. Okay? Now, next is, yung iba sa inyo sabi, probably nag-partograph kayo. Okay lang? At yung iba, probably nag-vaginal exam. But yung iba, or most of them, hindi kayo nag-suture. But my dear nurses, these are the expected competencies ng isang maternity nurse. In fact, my dears, ang midwives, ginagawa po nila ito regularly on a routine basis. I'm so sorry, okay, to say this, but sometimes when I train nurses, kagagaling ko lang sa nurse certification training ng DOH last month, no? I have to make use of some expert midwives to demonstrate. Kasi yung nurses ko, well, magagaling din. May magagaling, pero few. Yung talagang nasa DR lang. Okay? So, should you intend to become a maternal and child nurse, you have to more or less master this. Ha? So, anyway, we'll go into this. This I will tell you lang, ha? Itong partograph na ito, okay? Iyan, please, pakitanong mo nga kung nakuha nila ito sa lecture. I would just want to know kung merong hindi pa na nabigyan ng lecture nito.
Hindi pa raw po.
Oh my goodness. O sige. So part of my overview will be just to show you. Pero my dear ha, ito sasabihin ko. The Board of Nursing has encoded partograph questions, pero we are still doing this in the hospital setting and in the lying in. But be ready in about 3-4 years, mapapalitan ito ng something more. the DOH has already started to train the use of the labor care guide, which will replace the partograph. But for the purpose of the board exam, kasi naka-encode naman ito, we will be taking this up. Okay? Sige. So, sa postpartum naman is 6 to 8 weeks ang duration niya. So this is in between. We provide immediate and routine care. So when we say immediate postpartum care, my dear nurses, ang nasa isip nyo lang will be hours. Generally, the first 2 to 4 hours, no? 2 to 4 hours, no, of post-delivery. And this is considered the 4th stage of labor. Okay? And the routine care will come within 24 hours and up and down, and down to the 10th day or down to the first 4 weeks to 6 weeks. So, ayan ha. Okay. Complications can set immediately after delivery. This is also one of the most critical. Aside from the labor delivery phase, the 4th stage of labor is the most complicated stage. Okay? My dear nurses, I've been in the delivery practice for decades. Hindi ako takot sa first stage of labor. Kasi sa first stage of labor, bababa ang bata, whether you like it or not, because it is the baby performing the mechanism of labor or the cardinal movement. So if the labor is normal, if the pregnancy is normal, wala ka lang gagawin kundi i-monitor that the baby is descending or is stationing, okay, per schedule. Okay? So hindi ako takot dyan. Nag-a-assess lang ako ng any abnormality. Hindi rin ako takot sa delivery process, sa second stage. Why? It is the baby that will what? Expel himself. Siya ang magpapaanak sa sarili niya. In fact, in one of the pediatric books, no, nakalagay, birth is the most traumatic experience of the newborn. Sino ang lumalabas? Yung bata. Ang anong ginagawa natin? We are just assisting the birth of the baby para walang mangyari sa baby after. So if the delivery is normal, okay, then if the delivery is normal, then the baby will just come out naturally. Okay? However, eto na, sa placental stage ako, natatakot. Even up to now, if you ask me to handle. Why? Because the placenta needs to be expelled by the attendant. And you need to have the perfect time for placental expulsion. Even if you have a perfect time to expel the placenta, sometimes the character of the placenta does not expel spontaneously. So what do? Abay, maglibid ang nanay. Please remember this. For us, once the baby is delivered at nasa 3rd stage of labor na tayo, the placenta now becomes a foreign body to the uterus. Basta nakat na ang umbilical cord at nakalabas na ang bata, yung placenta becomes, okay? The placenta now becomes a foreign body. Okay? And the uterus will never contract for as long as there is a foreign body inside it. Kailangan tanggalin mo ang uterus para ang placenta para mag-contract siya. Even if natanggal na, if it is not complete, there are still cotyledons or there are still membranes retained. Hindi yan magko-contract ng gusto. So magko-contract, relax. Contract, relax. And once that uterus relaxes, the mother bleeds. Gets nyo? So the most critical is the 3rd stage of labor on to the 4th stage of labor. Kailangan maagap ka. Kailangan alerto ka. Hindi pwede yung aantok-antok. And you should know what to do. You should be equipped with the skills to do something emergency while you are waiting for the doctor to come and manage the situation. Okay? Mas ayan. Okay. Follow-up care is necessary to ensure healthy transition from from birth to the non-pregnancy state. So kailangan ang postpartum care, kailangan ang postpartum visits. We go to child health. Now, this includes child health. You know, what is a child? Definition of child health. So child health includes the care of the newborn to adolescent. So we take care of, pero kasi child health ito ha, newborn to adolescent. Sa maternity nursing kasi, we come even before the newborn. We care for the baby even before it is born. So, sa maternity nursing, kasama si fetus. Okay? So, the fetus is also a client of the maternity nurse. And my dears, since she is your client or your patient, the fetus is also a patient, then definitely, number one, you include assessment of the fetus na hindi mo nakikita. And number two, you provide care for the fetus if you see that the fetus is compromised. And number three, you also record all about your assessment on the chart of the mother and the baby. So, rine-record mo din yan. So, tatlo yan ha. Assessment, and then nursing management, okay? And then, of course, your recording or charting. Okay? Now, sa child health, newborn to adolescent, as I said kanina, we have to draw the line between maternity nursing and pediatric nursing. Okay. So pag pedia nurse ka, from newborn ka to adolescent, sa iyo yan. Okay? Now, maternal and child nursing, I said this earlier, includes immediate neonatal care. So yung ENC, Essential Newborn Care, is part and parcel of maternal and child nursing. Here. So, kasi immediately after, anong gagawin mo? Sino ba ang nasa delivery room? It's not the pediatric nurse, but the maternity nurse. So, master nyo dapat ang competencies that are being asked of you in MCM. In ENC. Sorry. It also includes breastfeeding. As I said, the maternity nurse prepares the woman even in pregnancy to breastfeed her child. So, may question ha, when should breastfeeding and family planning be started to be taught to the woman? The answer is sa prenatal care. So, you don't wait until delivery, you don't wait until discharge, but you start sa prenatal care mo. In fact, you can always mention this as part and parcel of your goodbye for now instructions. O Mrs. ha, o ang susunod na visit mo, magkikita ulit tayo sa October 12. Okay? At tandaan mo Mrs., okay, pag-isipan mo na kung anong method ang gagamitin mo sa family planning or kung tatanggapin mo. And please, Mrs., ihahanda na rin natin ikaw sa pagpapasuso. So palagi kang nagaganyan. So in other words, what are you doing? You are brainwashing the mother for her own good and for the baby's good. Okay? So include breastfeeding. Dapat dito family planning pa ha. Kaya lang kasi this is under child health. Okay, so women's health. So if you notice, I went per area to area, no? So tapos si child health, okay? And then we are now in reproductive problems of the non-pregnant woman. So this is where I will only discuss what it is because gynecology, as I said, is not really the turf of the maternity nurse. The nurse who is assigned in my women's health clinic is what do you call this? Assigned there primarily to manage the clinic, okay, to lead the clinic, administration of the clinic, and to assist the doctor, as well as to make the first or initial assessment. But it is usually the doctor that comes in later to fulfill the management of the condition. So vaginal infections. By the way, whether you are pregnant or not, basta babae ka, of course, you are prone to vaginal infections. Yan. Ha? Non-pregnant or pregnant, you are prone to vaginal infection. Why? My dears, tawag nito, the vagina is a very, very attractive organ for microorganisms. Please take note of that. No? The vagina has the best environment for infection. Okay? However, no, merong built-in na defense ang vagina against infection. And that is the Dodderlines bacilli that provide acidity so that organisms will not thrive in an acidic environment. However, pag acidic yan, natatanggal din yan. Na-de-acidify, if there is such a term, or na-alkaline ang vulva. I will now call it as the vulva, okay, or the vagina. How? Kasalanan din ng over-malinis, over-obsessive, obsessive na babae sa kalinisan. Ha? Sa kalinisan. So what do I mean by that? Well, there are some women na masyadong ok-ok. Alis si kuya mo. There are some women na masyadong ok-ok, no? Ay, sus Mariosep, na every time they go to the CR, they wash and soap and soap and soap their vaginal canal. Soap, my dear children, no, is what? Alkaline. Sodium yan eh. Okay? So if you keep on removing, if you keep on doing that, then matatanggal yung acidity ng mother. At pag natanggal yung acidity ng nanay sa vaginal canal, matatanggal yun din ang Dodderlines bacilli. Malelesen ninyo. So that vagina will now welcome all the organisms, no, that can be welcomed into its canal. Okay? Okay, so remember also, ha, when I was a student, never mind kung kailan yun, ha? Okay? When I was a student, bata pa si Isabel, isa lang ang organism na alam namin, na tinuro sa amin ng doktor, because we have the doctor's side and we have the nursing side, no? Sa aming lectures. So the doctor said, isa lang, no? We were always talking about the bacillus, si Dodderline. Aba, remember that this is a science and we have research. Napaka-active ng research natin. Ang tatalino na ng mga tao sa mundo. So they discovered, not really discovered, they highlighted already that hindi lang Dodderlines ang nasa vaginal canal but other organisms as well. The vagina is a haven, H-A-V-E-N. It's a haven of organisms. Bacteria, virus, protozoa, chuba-chuba, lahat yan, nariyan sa vaginal canal. Once na-lessen ang immunity ng nanay, these bacteria or these organisms can invade, no? Can go up and cause problems into the reproductive organs of the woman. Okay? So, yan kaya nagkakaroon ng pelvic inflammatory disease that can cause a lot of problems later on. But what we're going to take up now are the common, no, vaginal infections encountered by women daily. So we'll talk about it in terms of the cause, what organism is causing it, what is the characteristic sign, and what is the treatment. So you have here 4. 1, 2, 3, 4. So, I'm sure you have taken this up. Okay, as I said, review is mastering the concept. Para isang tingin mo lang sa question, alam mo na more or less kung ano ang iyong pipiliin. So, among all this, the most common, seemingly, is moniliasis. Now, this is caused by a fungi or a fungus. Okay, si Monilia, si Candida albicans, no? And the characteristic sign is a whitish. She's like, no, a substance between the labia majora and the minora. Mapulang-mapula. If you're going to open the vagina, the labia majora, buksan mong ganyan, makikita mo mapulang-mapula yung pisngi. And then when you put your 2 fingers down, ibababa mo siya, ibaba mo, no? So ipasok mo ito, ibaba mo siya, naka-light ka dyan, naka-spotlight ka, you can see that there are, what you call this, specks of whitish substances doon sa vaginal canal, tapos mapulang-mapula siya. And the woman will complain of severe itching, pruritus vulva. Ma'am, ang kate-kate, gusto niya talagang what? Kamutin ng kamutin ng kamutin. So among all these 4, the Monilia is the most what? Itchy. Kung pwede lang kamutin yan, every 3 minutes gagawin, no? So definitely, the woman will come to you because of the discomfort. Di na siya makatiis, no? Makating-makati talaga. Even in her workplace, nangangati siya. So what is the treatment? Simple lang. Okay, remember treatment, these are all abnormalities. So the nurse cannot give the treatment, but the nurse can make the assessment. Magyabang din naman kayo kasi ako nun nagyayabang just to show the doctor na marunong ako. Doktora, kasi I can open the labia majora. I can open that, no? And I can see. Doktora, okay, itong si Miss ganito, sabi ko, is complaining of severe itchiness. Na-inspect ko na, doktora, while flashing, no, for your immediate assessment, na-inspect ko na yung labia majora and minora, doktora, mapula at may mga puti-puti. Doktora, I believe that this woman has moniliasis. Ang yabang ko, no? If you do that, impresin mo naman yung mga doktor para hindi ka lang assistant. This is what the global nurse does in her practice. The global nurse suggests and sometimes, sorry for the term, corrects the neophyte doctor sa mga assessment. Kasi if you've been there for years, Diyos ko, kahit natutulog ka at nananaginip, alam mo yan. Pero yung mga bagong doktor ko minsan kasi, yung mga bagong interns or clerks, hindi nila alam yan. So try to teach them. You can be a mentor and you can teach them. So what is the treatment? This will be your clotrimazole. It has to be a drug that should be given, clotrimazole. And it can be a suppository, a vaginal suppository, or an oral medication. Depende. Depende. Okay? So, can be a suppository, vaginal, or it can be an oral, clotrimazole. Huh? Now, trichomoniasis is caused by a protozoa. Okay? Characteristic sign dito is mabaho, foul. Characteristic sign is a foul odor. Pagbuka mo pa lang, talaga naman. Buti na lang nakamask ka. And then, when you try to check on the vulva, okay, again, while you prepare, you can again check. Makikita mo, no, you can lower down the perineal area. Makikita mo there is a greenish, greenish, foamy. There is a greenish, there is a greenish, foamy, creamy, foamy, mabula-bula, foul secretion. And pag yun ang nakita mo, automatic, sino yun? Sino yun? Ha? Okay. Greenish, foamy, no? And you know very well that that is protozoa. Okay? So if that is a protozoa, we go to a drug given again to women. And this is metronidazole or the flagyl. And then of course, a common bacterial vaginosis. May characteristic odor din ito, but not as much as trichomoniasis. And the secretion is grayish. This is quite common next to moniliasis. And the chlamydia, which is bacterial in origin. By the way, bacterial and chlamydia, which is bacterial, are treated by antibiotics. Okay? And there is no sign for chlamydia unless you do a vaginal smear. Get a tawag nito slide, get your cotton pledget, you just put on your swipe your your pledget and put it on your slide, then give it to the lab. Part of your role is to collect specimen as well. Okay? Part of your role is to collect specimen. So dun makikita kung chlamydia yan or not, no? So if it's a chlamydia, symptomless, so they give tawag nito antibiotics. Okay? So we give antibiotics. Then we go to one of the most common disorder ng mga Pilipino. Ewan ko ba kung bakit ang mga Pilipino na babae may mga menstrual disorders. My goodness. Okay? My goodness. Because I have interacted with American women, I have interacted with British particularly. Yung mga British women are very regular. Very regular. Bakit sa Pilipino, Diyos ko po, ang menstrual disorder. Even among you kayo lahat ng mga babaeng nagre-review ngayon or nakikinig ngayon sa akin, I'm sure some of you, if not a number of you, have these problems. No? So, iniisip ko tuloy, what is one very important, to call this, factor siguro is number 1, siguro nutrition. Kasi tayo mga Filipino, para tayong mga ibon kung kumain. And our choices of food are not really that balanced. Kung pizza tayo, hanggang pizza na lang. Kung fast food tayo, hanggang fast food. Okay? We are not very conscious so much of our diet. Except pag tayo nag-intermittent fasting or nagda-diet, etc. Another factor I think is the climate, no? Mainit masyado, tropical tayo masyado, okay? At any rate, pero minanotice ako from my time to your time, mas maraming problema our time. And isang factor pa pala, my dear, sa menstrual disorder is the big factor of stress. Naku, I think stress is a millennial and a Gen Z term. Yan ang inyong sakit sa generation nyo na ito. Sino ba naman ang walang stress? Sino ba naman ang walang problema? Sino ba naman ang walang concern? Pero kasi kami nung araw, we took that as part and parcel of life. Ngayon with technology kasi, with social media, nafo-focus ng husto ang ating mga problema and stresses. So, lalo tayong nag-o-overthink. I am stressed, okay, etc. So, pati yan, pumapasok sa utak natin, no? And then, ang tawag nito, inaano ng utak natin, pinoprocess ng utak natin until eventually, remember that the brain dictates the body. The brain dictates, no, the organs. Hanggang sa later on, no, urungan ka na ng regla because of so much stress. Nangyari din yan sa akin, ha? Nangyari din yan sa akin. Okay? So I will talk of my personal experience as well as of course the vicarious experiences and the actuarial experiences that I have met in my practice, no? Irregular, okay, until irregular ako until I got married and had kids. Okay? And when, ito lang just to tell you that you are normal, may mga iba sa inyo ngayon hindi na rineregla ng maayos. I'm sure, lalo kayong hindi rereglahin pag malapit na, baka ma-miss nyo ang period ninyo sa May or ma-miss nyo na ang period nyo this April or even since March, di ka na rinegla. For as long as wala kang ginagawa, no problem. Kaya ka lang naman mamumroblema pag may ginagawa ka, of course. And you alone know that. No? Okay, so time when I was taking my board exam sa US, kasi doon kami nag-NCLEX, no? Alam niyo ba na I did not have my menstruation, no, for 4 months. And then nung lalabas na yung result, Diyos ko, bumuhos na parang waterfall yan. Again, it was my mind dictating to my body. Okay? So, ganun lang yon. So, as long as wala kang ginagawa and you miss your period, focus on the review para hindi ka ma-distract. Darating din yan. At pag dumating kung minsan, una, patak-patak, and then later on, bubuhos ng husto. Ganun si irregular menstruation. So, menstrual disorders or disorder is defined as a vaginal bleeding outside of menstruation. Okay? Kasi there are some lay person, some of our lay clients, no, that would say, "Ma'am, rineregla ako." Only to find out, sabi niya, "Ma'am, pupunta sa, ma'am, ngayong buwan ho, tatlong beses ho akong rinegla." Ha? You have to define. Eto na, pupunta ka na. Kailan ang regla mo? Kailan ka unang dinugo o rinegla? She will tell you. And then based on your assessment, based on your knowledge, this is the real menstrual period. And then after 5 days, rinegla na naman. And then after another 5 days, rinegla na naman. You know very well that that is already outside of menstruation. Therefore, hindi na yan regla, kundi abnormal uterine bleeding. That is now our current name. The current name of bleeding outside menstruation is abnormal uterine bleeding, which consists of dalawa, irregular menstruation and dysfunctional bleeding. Okay? So irregular menstruation means pwede kang mag-bleed. Dysfunctional bleeding means nagluluko talaga, hindi mo na ma-identify ang menstrual period mo. Irregular menstruation means you can identify your period but then you bleed in between or even no bleeding in between. Okay? So these two. So what are the treatments or what do we do? Generally, sa irregular menstruation or dysfunctional bleeding, our first line of management is medical drugs or pills. Yung oral pills natin, yung estrogen progesterone natin. So our oral pill is not only for method purposes. Hindi lang siya para how do you call this? Ma-interval ang pregnancy. But it is also used to treat problems. Okay? Now, why? Kasi ang menstruation is controlled by hormones. It is controlled by the brain. It is controlled by your hypothalamus. It is controlled by your FSH, LH. It is controlled by your ovaries, estrogen, progesterone. Okay? And it is controlled by your uterus, proliferative secretory. Okay? And ano pa kundi ang pill ang makaka-manage at makaka-control ng mga hormones na ito. So we give oral pills. In fact, when we regulate menstruation, kasi there are teenagers that come to us or young women that come to us, no, sa gynae clinic namin noon, who would want, "Sir, ma'am, I am getting married next month. I am engaged," or next month, "this year I am engaged, but my menstruation is irregular. Can you help me regulate because I want to have a child immediately?" So yun, ang tawag namin doon, when we regulate menstruation, is the Grodens method. GRO. Iyan, nakikinig ka pa ba?
Yes, Doc.
Very good. Pwede ka nang mag-lecture. Sino kasama mo? Si Peds?
Yes po, Doc. Nandito po si Madam Feds po.
Si Aldrich?
Yes po.
Oh. Tingnan mo nga. Mababasa nyo? Basa?
Yes po, readable naman po.
O sige, basahin mo. Iyan.
Rodens method po.
Okay. So, That method is the treatment that we use to regulate menstruation. And what is that? We give pills for 3 months. 3 months yan, initially. Okay? And then, after 3 months, we withdraw. Tanggalin namin. And see whether the ovary has regained its motility to produce an egg. Okay? So, pag hindi rinegla, after na withdraw namin yan, balik uli kami. We make it 4 months. Until, pag tinanggal namin, let's say 4 months, depende sa response, then when we remove it, then we wait, and then once na nagregla na on its own, then ayun na. So that is our front line. Okay? Or pag nagdi-dysfunctional bleeding, the pills will control the bleeding. But there are times when hindi na makontrol kasi kung minsan naman dumarating sa amin, grabe na eh. Alam nyo ba, may dumarating sa amin, 3 weeks ng dinudugo, 1 buwan ng dinudugo. Diyos ko, pag ganyan na may nagpakita sa amin na, ma'am, 4 na linggo na ho akong dinudugo, automatic yan, CBC ka kaagad, nurse. You want to see the hemoglobin level. Definitely, babagsak yan sa 7 grams na lang yan. And so, you anticipate that. And sometimes, baka mamaya, this woman might need an immediate blood transfusion for consistently bleeding. Makikita nyo yan eh. Aside from the pallor na makikita nyo sa conjunctiva and sa lips, no? Validate it with the CBC for hemoglobin determination para makita nyo. Okay? Our next is we do surgical. Generally sa dysfunctional bleeding, we do a DNC. Kasi ang DNC, hindi na makukuha ito sa pills lang eh. Or bibigyan namin ng pills, pag hindi pa umandar, we do not want continuous, kasi itong dysfunctional, malakas ito eh, nakaka 2 pads, 3 pads a day ito eh. We cannot anymore, tawag nito, tolerate this type of bleeding because it is already detrimental to the health of the woman. Anemic na siya. So what do? We immediately admit this woman and do a DNC. Okay? Yung endometrial ablation is removing the thin layer of the endometrium. Mas matindi itong procedure. We do not usually do this unless necessary. Kasi sa DNC lang, okay na. What do we do in DNC? We remove the extra endometrium. So we do an ultrasound and see how thick the endometrium is, and then we try to what? To curate. We use the curette, and then we try to scrape the extra endometrium. Alam nyo, pag may extra endometrium yan, hindi titigil ang bleeding hanggang hindi nyo matanggal. Okay, once natanggal nyo yung extra na endometrium na yan, believe you me, next day, discharge ang nanay, patak na lang, panty liner na lang ang gamit. Clear? And then you go into the possibilities, bakit ganun? And then you go into a long-term treatment. Okay? Sige. Next. Infertility. So infertility is now increasing. I have a lot of information about infertility. Nung time ko, eto lang ha, when I was in the delivery room practicing, when I say practicing, I managed the delivery room for some years. When I said I manage, ako ang nag-in-charge, ako ang nag-procure ng medications, nag-procure ng mga instruments. I made the delivery room really, tawag nito, an ideal delivery room where there were administrative concerns. Ako ang hahawak niyan. But I also practice because kung walang tao or kulang ang tao, ako ang sasabak. So I did that. And I noticed during my time that the normal average parity of those we were handling were between 6 to 8 gravidas. So every time, kasi ganito every time na may papasok na nanay na i-deliver sa delivery room namin, our attendant will always say, gravida 4, gravida 5, normal, gravida 4, breech, ganyan. Our attendant are instructed to bring that patient to the DR, sabihin mo, bridge presentation, pang-4. So, dun pa lang sa entrance, sasabihin na ng attendant na nag-wheel, nag-transport ng patient na gravida for bridge. So, we know that this is a multigravida na bridge presentation. So, ang magpapaanak lang yan ay yung doktor. Pero pag sinabing gravida for normal, automatic, any person can deliver, the midwife, the student, the nurse, or even the attendant kung wala nang tatao. Okay? So I noticed that the parity was between 6 to 8. Believe you me, nagpaanak pa ako ng gravida 14 or gravida 17. Hindi ko na matandaan. Basta ganun. Kaya lang, 42 years old nun ha, gravida 14 or 17. You know what? Right after the delivery of the baby, Diyos ko, the mother, we anticipated it. So before the delivery, nag-insert na kami ng IV, naka-inject na kami, naka-incorporate na kami ng Pitocin, naka-off lang yung IV. Right after the delivery, full blast namin, and as expected, lumambot, hindi nag-contract ang uterus. So even after several minutes of full blast na Pitocin, and then relaxation, massaging, hindi. So automatic, the doctor said, OR tayo for hysterectomy. Yan ang mga senaryo ng araw. Ngayon, as I notice based on my trainees, okay, I would ask them, what is now the parity of your clients in the DR? Ito na ngayon, the normal average parity is 1 to 2, either primary or number 2. Yung gravida 3 hindi na rin masyado. So what does this mean in your generation now, mga millennials and Gen Z? In your generation, mukhang naka-mindset na kayo hanggang 2 sa maximum of 3 lamang. So nagpapalit na ang mindset ng mga women. Okay? So before, when I was having 100 to 120 deliveries per day, ngayon nasa 60 to 80 deliveries na. And naglilimit kami ngayon, so we have around 25 to 30 lang per day. Because we limit because of our resources. Okay? So, infertility. Also, what we notice now is, okay, so there are couples na ayaw na rin mag-anak. Ayaw na rin magkaroon ng baby. They would rather have fur babies. So you know what I mean, fur babies. I'm talking only of the Filipino as well as the global couples. They find babies or children a barrier to their lifestyle. I know of one couple who said, hindi na lang kami magbe-baby because our jobs take us to several countries every month, and we cannot know how to manage if we have kids to take care of. Okay? So hindi na. So hindi na yan. And so, okay, and so the POPCOM, Population Commission of the Philippines, has, I think you have heard this, has informed the public and even the DOH, no, that our fertility rate has gone down. Yung target na fertility rate na mababa in 2025, according to the head of the POPCOM, is now achieved. That means to say, very aware na ang Filipino women sa fertility nila. Okay? So, infertility is unable to become pregnant 12 months after marriage or after union. When I say 12 months, regular coitus, okay, regular intercourse. Don't ask me, ma'am, what is the standard regular? Hindi ko alam, walang libro ang nagsabi niyan. Depende yan sa inyo. The same na hindi ko rin alam kung ilang milyon o libo ang pubic hair kasi walang libro na nagsasabi niyan. Okay? So, the coitus or the sexual activity will depend upon the couple. Basta, it's on a regular basis. Kung ang regular nila is twice a month, then so be it. Kung ang regular nila is once a week, then so be it. So after regular coitus at wala pang baby after a month, after 1 year, then we say that there is some infertility. Okay, so abroad, pag ganito na and the couple really would like to have kids, no? The couple really would like to have kids, they usually consult fertility doctors. Pero sa Filipino kasi, we are not very conscious of this, no? So antay lang tayo ng antay. But what we tell the couples is don't wait too long. Kasi alam ko we had two cases, isa nag-antay ng 10 taon, isa nag-antay ng 7 taon, ay wala na kaming magagawa. Nagtampo na talaga, nagsara na talaga ang tindahan ng ovary at saka ng sperm. Okay? So, if you really want children after 12 months, pag wala pa, consult. Sometimes this is caused by menstrual disorders. So, what do? We manage muna the menstrual disorder. Or it can be caused by a more serious condition in the woman, which we call endometriosis, which is again common. So what is endometriosis? Endometriosis is a painful disorder where endometrial tissues grow outside of the uterus. Please take note, outside, when we say endometrial tissue, dapat yan nasa endometrium lang as part of the uterine innermost layer. If there are endometrial tissues that grow outside of the uterus, then endometriosis can occur. Bakit nagkakaroon ng endometrial tissues? Menstrual reflux. During menstruation, kung minsan, naglalakad yan. Yang mga endometrial cells na yan. Instead of falling down with the menstrual flow, kung saan-saan nakakarating. So it can involve the ovaries, it can involve the fallopian tubes, and the tissue lining of the pelvis. O, eto tayo. So this is a picture of endometriosis. Yung kumpul-kumpul na yan, these are part of the endometrium na nakatakas, nagpunta rito sa may fundus, nagpunta sa abdominal cavity, ayun, nagpunta sa ovaries, ayun, sa inner lining of the pelvis, ayun. And remember that the endometrial cells react to the production of hormones. They respond to hormonal influence. So, kung remember that ang hormones are very interactive during the menstrual period, prior to menstrual period. So, pag yan nagkakaroon na ng mataas na level ng estrogen, progesterone at babagsak, pati ito, this will become inflamed, sasakit ng husto. And so you have the term endometriosis. So what is the treatment? Abay, sunugin nyo yung areas na ito. Ito. Okay? So we have polycystic ovarian syndrome. Very common to. No? Very common, especially among women na medyo chubby women. Common ang PCOS. No? Chubby women, common ang PCOS. The more women they become more muscular, more hairy, okay, chubby. So this can also cause infertility. Okay, so they develop follicles inside the ovary. So when we say follicles, nagkakaroon ng fluid inside the ovarian follicles, and so they bar or they stop the release of eggs. So etong itsura ng polycystic ovarian syndrome. Again, this can be treated by pills. And ang isa pa, the last discussion that I would like to take up with you okay, is the cancer in women. Please take note, cancer is rising. Hindi katulad maraming causes ang cancer. It can be nutritional, it can be, alam mo, it can be the stress factor again. Kaya dumadami ang cancer sa panahunan nyo, sa generation ninyo, because you are so stressed out. Hindi ko alam kung anong ginagawa ninyo, kung bakit kayo na-stress out. Maybe because life is so fast and furious. O ayan. Life is so fast. Life is so furious. Pati ikaw, kakain ka lang, nai-stress ka na. Papasok ka lang, nai-stress ka na sa trabaho. What do I mean by that? Gigising ka na, i-stress ka kasi late ka na. 4:00 pa lang ng umaga, late ka na. Why? Sa haba ng traffic. Aba, relieve your stress. E di tumira ka sa malapit sa opisina mo. Have a dorm. Ba't kasi uwi ka ng uwi? Kasi ma-stress ka kasi kulang ang sweldo, hindi nakakaabot ng kinsenas. Kasi naman, do something. Simplify, simplify, simplify. So reduce your stress. Ikaw lang ang nakakalam nito. Or manage it. O ayan. For the last 2 days, you have had the brain expert. Si Ma'am Lucy nyo, my best friend. Brain expert yan. Ay nako, ang stress management niyan, ang kanyang mga anxiety. Kung ako minsan nagbe-verbalize, kasi syempre stress out din ako, nagbe-verbalize din ako ng anxiety ko. Diyos ko, lecturean na niya ako ng mga gano'n. Sabi ko, hoy, alam ko na yan. Sabi ko, sige, mabuti rin yung naririnig ko sa iba. Okay? But manage your stress. Manage your anxieties. It is normal. Hindi ba? It is normal not to be okay. It is normal to be stressful, but it is not normal if it will already over the whole day. Kung walang nangyari, kundi puro anxiety na hindi ka na makakain, hindi ka na makatulog, ay ibang usapan na yan. Okay? So, stress has been identified as one very important factor of cancer in women. And mind you, this I will tell you, cancer increases with age. As you age, cancer will be lurking around the corner. Okay? And so, we're talking only of women. The most and the number one is breast. Cancer of the breast. Okay? Then you have cervix, uterus, ovaries. My dear nurses, please take note, no? One of our important function or role in women's health is assessment, early detection. Now, sa breast, among all of these, breast is the number one, but this is also the most curable. It is reversible. Okay? And so, what were we taught in school? Anong tinuro sa atin? We taught or we teach our client how to examine themselves monthly. So you have the self-breast exam. Okay, SBE. So the procedure, alam nyo na dapat yan. Kasi pwedeng tanungin yan. No? So SBE is, okay, then aside from the self, you have to be seen annually by a doctor. So when you go for an annual PE, okay, kasama po ang pagpapalpate ng breast normally. Okay? And then kasama ang yearly mammogram for those high risk and for those 40 and above or even 50 and above. Kailangan ng yearly mammogram because that is the most significant. Ang SBE na the SBE is just a, how do you call it, presumptive sign. But the mammogram is a diagnostic sign that will be confirmed by the biopsy. Okay? Now, so ito ha, breast, very common among women. Next is cervix. Kaya lang, among these, ang pinaka-preventable now na cancer is not the breast, but the cervix. How? Di magpa-vaccine ka We have our anti-cervical vaccine that when given can reduce the incidence of cervical cancer. The cervical cancer is generally caused by HPV virus or the human papilloma virus. Okay? And so, for as long as wala pang sexual intercourse prior, kaya binibigay ang cervical vaccine at an early age as much as early high school, basta wala pang intercourse. Kasi minsan yung HPV is transmitted through intercourse, ha? Okay. So, we give that and we do that vaccine. So, therefore, that prevents cervical cancer. Uterus begins with myomas, and then it can become cancerous or it can be a cancer of the endometrium. So merong isang vlogger na popular nagkaroon ng endometrial cancer. I just forgot her name. And then of course, the worst is ovarian cancer kasi ito makikita lang on the late phase. Hindi naman kasi normal na mag-ovarian ultrasound kayo or mag-ultrasound kayo every year, but it is normal that pinapalpate ang breast nyo yearly and that you do a pap smear yearly. Pero yung ultrasound of the uterus and the ovaries, this is only done when there are some clinical signs. Okay? So, pag may clinical signs kayo nakikita, like one of the signs na inu-ultrasound na is that medyo may napapalpate sa uterus na hindi naman dapat dahil hindi ka buntis. So malaki uterus mo or may spotting ka. Now in the ovary, you have pain in the ovary. Okay. So ayan, ha? Cancer in women. So legal MCN practice, before I go into the next phase, Iyan.
Yes po, Doc.
Break muna tayo. Gutom na ako, ha?
Sure po.
Okay, I'll come back at around, mga 20 minutes or so.
Okay po. Sige po,
Okay.
mga 10-10 po.
Okay. 10-10 ba, hoy?
20 minutes po ba?
Oo, 5. Ano ka? 5 to 10 na sa akin. Ano ba? 10-15. Ewan ko. Hindi yata tayo magkaano.
Ay, wait lang po. Ay, sige po, sige po.
Sige, ha? Okay.
Okay po.
Give me some time. I need to drink water and hydrate. Ha? Okay.
Yes po.
Okay. See you later.
Sige po.
Okay. Anong gagawin Hello?
Hello, Doc.
Okay, we start. Are you okay?
Yes po, Doc.
Talagang hindi ko matanggal-tanggal tong screen dito. Kainis. Yung maliit na screen na bintana. Kahit mag-click ako over, under, and ayaw. Anyway, okay. So we go to, can you see my screen?
Yes, Doc.
Okay. So we are now in the legal basis of maternal and child nursing practice in the Philippines. So when I say legal, what dictates our practice, tawag nito, legally? Or what makes us relevant? What makes us do things as they are? And that we cannot be charged of malpractice. Kasi malpractice means you do things outside of your scope. So malpractice siya. Negligence means hindi mo nagagawa or nagkakamali ka within your scope of practice. So let's go to our number one legal basis. Our number one legal basis is Republic Act 9173, which is the Philippine Nursing Law. So if I am sure you've talked about this in your tawag nito, Prof ad and all, so I don't need to elaborate except that it is stipulated in that law that we really take care of pregnant women, we really handle deliveries, we do IE and suturing, and we do and perform care of the newborn baby. So walang problema doon, no? So some midwives are questioning, no, our tawag nito, our capacity to manage a birthing center. Ang sagot naman ng mga nursing leaders is, "Oy, nasa law namin 'yan." Sabi niya, nasa law din namin. Oh, they let us live in peaceful existence. Basta if the nurse wants to put up her clinic and she is confident, she's competent, and she performs or she complies with all the requirements, walang makaka-question sa that. I mean, on that. Clear? However, you know very well that there is a nursing bill, okay, pending in Congress. Approved na yan noong time pa ni Duterte, but, nung time pa ni Noynoy Aquino, this bill has been there and was approved, and it reached the table of Aquino, but he he disapproved it only because of the salary grade 15. Sabi niya, hindi kakayanin ang salary grade 15 because it will affect other professions as well. In other words, ganito ang sabi niya, no? Pag na-approve ng salary grade 15 as the minimum basic salary of nurses, kailangan yung mga ibang professions na aligned with nursing must also increase. And yung mga professions that are above nursing must also increase para ma-maintain ang difference. So, up to now, yan naman ang number one na problema. Okay? But I'm not talking about that, but I want to talk about this one. The important thing or significant in that bill is the presence of is the enhancement of the scope of practice into advanced practice nursing. So ito wala ngayon sa Republic Act 9173, pero in our bill, once approved, will now give and open the horizons for all nurses to put up their own advanced practice. No? So what are these? So abroad, there are 4 classification. I was once a part of the planning of this nursing bill. Noong pa ito hindi pa ako retired, meron na. So I sat in 1 or 2 or 3 of the sessions. And the basis of our the basis of all our recommendations were some taken from the global. We looked at US, we looked at UK, and some also in Asia, Southeast Asia. We look at Thailand, we look at Singapore, and then we look at what was best for us. Now, based on this, okay, there are 4 classifications identified, not in the bill, but in our benchmarking. So there are 4 classifications of advanced practice nursing abroad, and these are: number 1, definitely certified nurse midwives. So certified nurse midwives are midwives at the community level, abroad, okay, doing home births, doing water births, having their own clinics, cha. Yan. So ano na yan? Accepted na yan. Then we have nurse anesthetists abroad, no? So these are the nurses that would assist or perform simple anesthetic procedures. Once upon a time, in the DOH certification for nurses, when it started in 2011, we included nurse anesthetists as part of our specialty. Kaya lang, ang tawag, lumaban ang Association of Anesthesiologists, the doctors, no, in anesthesia, who said that they had 4 years of residency training to become expert in anesthesia, and here comes now a nurse lang. Ayan na naman yung word, nurse lang na mag-anesthetize only because of a training phase or course. Hindi naman tayo talaga magbibigay ng anesthesia, but we can intubate, we can give local, hindi tayo pupunta sa pinakamatitindi na anesthetic, and definitely we can partner and team with anesthesiologists. Pero nakahang ito. Hopefully, with this law, baka ibalik ito. And then nurse practitioner. Nurse practitioner means you are independently practicing your profession. And among all the specialties, no, in nursing, the nurse midwife has been in this practice for long. Okay? So midwives are at the very forefront of birthing practice in the community, but there are some nurses, not many, but a few, who also own their own birthing clinics. Okay? And so they are autonomous in their practice. And of course, the certified nurse specialists. Now, these are the nurse specialists in the hospital setting, like pediatric nurse, NICU nurse, oncology nurse, and abroad, sa UK, I for one can attest to this. There is such a thing called a person called a headache nurse. A nurse who specializes only in headache. Sa UK, ang hilig nila dito, no? So they have a stroke nurse, they have a seizure nurse, they have a headache nurse, they have a whatever nurse that you do. Hinihimay-himay na nila ang mga subspecialties. So that is how we are advancing in terms of practice. So advanced practice nursing in maternal and child nursing primarily prepares her to be an independent practitioner with a birthing clinic. Okay, another legal basis is Republic Act 7600 only in the Philippine setting. Again, what is this? The mother and baby dyad, okay, in a hospital setting or in any birthing setting, so that the mother and the baby are not separated but will initiate the breastfeeding procedure. Republic Act 128, Expanded Breastfeeding Act. Now, this was one of the last law about breastfeeding. So this instituted the installation of breastfeeding stations among companies with 100 female employees, and also integrated the breastfeeding course into the allied medicine profession. Ito, ang pinaka-latest in 2012, Republic Act 1035-4. This is very controversial, but this is actually the heart of the practice of the maternity nurse. So this is Responsible Parenthood and Reproductive Health Law, the RPRH law. Now, if you go into the details of this law, no, you will see here that they define BMONC, they define CMONC, they identified the BMONC functions, they identified family planning methods, they identified everything about reproductive health, no, that can improve or that can be integrated into the practice of the nurse and the midwife. Take note, even the midwife is included here. Now, also in this law, nakalagay na rin dun yung provision that the nurse or the midwife can give life life-saving drugs in the absence of a physician, okay, for as long as they are certified to do so. So here came now the provision that the nurse can inject mag sulfate, antibiotics, steroids, uterotomins in the event of an emergency in the event of an emergency, while preparing the mother to be transferred to a hospital setting. So ito ang legal basis niya. Then we have Republic Act 11223. This is now the Universal Health Law. Okay? So ito, it wants health to be equitable to all Filipinos, that no Filipino should suffer and should not be able to get or access any healthcare service just because she cannot pay. Okay? And so the financial arm of this law is your PhilHealth. So all Filipinos are now enrolled for PhilHealth, for PhilHealth privileges. Now, what I would like to focus on is the support of the PhilHealth on maternity packages. Because obstetrics or maternity is such a common event in any community, PhilHealth has decided to support these women who are into pregnancy, labor, delivery, and even newborn by developing new packages, PhilHealth packages. Example would be this: for hospital delivery, 6,500 can be deducted from PhilHealth. So if the hospital charges, example lang 50,000, i-deduct mo na ito automatic. However, sa Fabelia, hindi naman kami nag-charge because free ang aming service. This alone suffices. So each delivery, PhilHealth pays us 6,500. However, if the woman delivers in the community setting, okay, then PhilHealth pays the midwife or the nurse midwife 8,000 pesos for the delivery process. Pag cesarean, which is in a hospital setting, PhilHealth, okay, of course, pays the hospital 19,000 for the package. For the newborn package, for the screening, as well as that will include the screening and the hearing test and the newborn screening and the hearing test, PhilHealth will pay, okay, the midwife or the nurse 1,750 pesos. So for the dyad alone, PhilHealth pays an amount of almost 10,000 pesos to the midwife or to the nurse or to the doctor that handles the delivery in her clinic. Yun. Kaya mayaman ang mga midwives. Republic Act 11210, which is the extended maternity leave, just to inform you, from 60 days prior to 105 days now. Meron na rin tayong breastfeeding leave and paternity leave. This one is important, Republic Act 9288, which is the Newborn Screening Act. Now, 24 to 48 hours after birth, okay, that should be done. It is not recommended to do it right after birth because you might not be able to detect the abnormality that you want to see. Because some abnormalities will only be detected only after 24 hours. But some would extend this to even 72 hours, no? So in Fabelia, we do this prior to the discharge of any baby. So 48 to 72 hours, here comes now our midwives, no? Doing or getting or collecting the blood specimen from the baby. These midwives, para hindi ko na magamit ang nurse, sayang ang nurse ang daming gagawin pa ng nurse. So I developed what we call this, a program for midwives to be trained primarily to collect blood for newborn screening, and that is what they do the whole shift nila. So nag-a-alternate sila collecting blood for newborn screening processes. I also develop a program for my nursing attendants to collect milk from all mothers who are in our postpartum area, no, for our milk bank, policies. So, in the newborn screening, PhilHealth covers 550 for 6 original, for information lang, no? And then not covered will be 9,550 kasi nag-add na sila ng other diseases. And so, these are, okay? So this is your law, collecting a few drops of blood from the heel into the filter paper, ideally should be within this. Enables, this is the most one of the most important reason, early detection and management of several congenital diseases, may lead to mental retardation or death if untreated. Okay? Early diagnosis, initiation of treatment, and appropriate long-term care will help ensure normal growth and development of the affected child. So this is, in a nutshell, the value and significance of our newborn screen. And to make it more specific, here is a visual slide, no, of our expanded. So these are our basic diseases. For years, eto lang ang chine-check. But now, since several years back, nagdagdag sila ng other disorders. So if you look, but these are the more common disorders that are usually detected, no? So congenital hypothyroidism, that's why we need to give iodine, no, to the woman dapat na pregnant, iodized salt, because she needs it for her fetus. Congenital adrenal hyperplasia, galactosemia, G6PD, nagiging common na rin to, phenylketonuria, maple syrup urine disease. And the current will include cystic fibrosis, organic acid, fatty acid, amino acid, hemoglobin, etc. So if you look at all this, most of these are diseases that affects metabolism as well as nutritional. Okay? So ito dapat ma-detect ito kaagad-agad. So that is the process. Prinik, tapos blinat sa filter paper, and this is sent to an agency that is accredited to perform the screening test. Initially, before, we were sending all our filter paper to PGH, our partner. And then Republic Act 10192, the CPD across professions. I'm sure this was taken by you, by your reviewer or professor in Prof Ad. So ensures lifelong learning, wala tayong problema. 45 CPD points, okay, at this point. No? We go to 10968, Philippine Qualification Framework Law. Now, the CPD program is undergoing some changes. We are now going into studying and planning for a career progression that will be based on our qualification framework. Okay? So later on, kayo ang matatamaan. The only training program that can be accredited for your in renewing your ID card, not the license, but the ID card, is a training that is related to your practice. So if you are a renal nurse, kailangan all about renal nursing or renal medicine. That will be accredited. Hindi ka pwedeng mag-MCN, hindi ka pwedeng mag-pedya. You have only to focus on your specialty. Yan ang future of the CPD program. And then, kailangan nakatutok siya. Okay? So, the PQF is a national policy. The levels of education are assigned. Now, this is aligned with the 10 ASEAN countries. So, level 6 is post-basic. Lahat ng mga 43 regulated professions in PRC are level 6. Level 7, certification for competence trainings. For example, ikaw na BSN ka, okay? Right now, my dears, you are level 6 graduates. You are level 6 in terms of the PQF. However, the minute na pumasa kayo sa board and then you go into practice or employment, you are now working for competencies. You are now under training. And some of you might be aiming for a master's degree. So, once na narito ka na sa this, you are now considered to be at level 7. Example of certifications. By the way, the training programs that you undergo in order to obtain skills are now being given certifications of skills. No? So you need a certificate to show that you have been trained in so and so. Now, right after passing the board exam, the first certification that you should enroll into and you should acquire is the IVT, okay, or the infusion, IV infusion training. Hindi kayo makaka-practice totally without this certification. All nurses must be trained to be an IV nurse because this is now the era of IV fluids. This is now the era of IV meds. Nung time ko, uso pa ang oral meds, no? Uso pa yung syrup-syrup. Hindi na ngayon. Okay? When you are in the clinical area, ang uso ngayon is IV push or incorporated into your Soluset, naka-IV pump, etc., etc. And how can the nurse function if she is not trained to do so? So yan ang number 1 na kukunin nyo. Now the others here are certification for the maternal and child nurse. So we have the MCN certification program, of which I am a trainer, being a level 5 nurse certified DOH clinical maternal and child nursing, maternal and child nursing. So, as I said, I just mentioned, no, last month I went into training again around 26 nurses from all over the Philippines, face-to-face, from Cagayan, Tacloban, Cavite, Mindanao. They are being sent by their hospitals free, ha? By the way, ang nagbabayad dito yung hospitals, ang binabayaran nila si DOH. And so, the DOH gives training for these specialty nurses. Meron kaming mental health. Si Ma'am Lucy is one of the trainer. Meron kaming renal, pulmonary, infectious, cardio, ortho, yan, pedia, maternal, etc. So, if you look at the website of DOH, nakalagay dun kung ano ang trainings na ino-offer nila that you can avail of. Now, another is family planning. Okay, there is a certification for family planning for the services that the nurse or the midwife can do. But hindi na ako nagpaano nito. I opted not to go into this kasi if I take the certification on this, matetenga na lang ako sa family planning. Ayoko naman nun. Gusto ko ng broader scope of practice. So if you are a family planning certified nurse, no, what does that mean? Okay, by the way, there are 3 roles of the family planning or the maternity nurse or the nurse. Number 1 is motivation. Number 2 is counseling. Counseling methods, about the methods. Tell the mother all the disadvantages and advantages and recommend what is best for her. That's counseling. But the third is you need certification. Ano yun? Provision of service. That means to say, the nurse or the midwife. This is in Republic Act 1035-4, ha? So nobody can question the midwife now. The nurse or the midwife can, number 1, dispense pills. Pwede ka nang magbigay ng pills. Okay? Number 2, the midwife or the nurse can insert the IUD. Pwede kang mag-pelvic exam. And if you think that the pelvic exam is normal and everything is okay, on your own, you can insert the IUD. Kasi trained ka, certified ka. Okay? But of course, you have a supervising doctor around na pwede mong tanungin in case you are not sure. Okay? And the third is, so insert the IUD, and the third is inject the implant. Inject the implant. Okay? So implant now is looking to be the number 1 preference of women now globally. Okay? So ini-inject nila ito. The midwife or the nurse who is trained can do this. Okay? Then we have the certification on BIMO. That means to say you undergo training for several weeks, undergo examination, you undergo laboratory exposure, you undergo tawag nito, actual clinical practice, etc. Now, once you are certified as a BIMO nurse or midwife, this is the primary qualification to put up your own birthing clinic or lying in. And the next, of course, is you can now do or give life-saving drugs in the absence of the physician on the drugs that you were trained for. So yan ang mga examples ng certification. Okay? Pagdating ng level 8 sa PQF, expertise na ito. That means to say, aside from this, may doctorate degree na. So your Ma'am Lucy and I qualify for this, no? In fact, sa PRC, we are at this level. And chief nurses as well as deans of the colleges of nursing must be at this level. Lalo na sa education. Doon sa nursing law, doon sa nursing bill na lalabas, palaging nakalagay doon, preferably a graduate of doctor of nursing or any equivalent. Yan. So with chief nurses or CNOs or chief nursing officers. Okay? So let's go into other legal basis. So I go into administrative orders from DOH. Basta admin, pag AO yan, ibig sabihin hindi yan law, pero administratively adopted as a standard policy by our Department of Health that controls the practice of the practice of health. The provision of services to the Filipino people. So we have your AO 0025 series of 2009. We have the ENC or the first embrace or the unang yakap. My dears, this one, no, I was part of this. Okay, we went all over the Philippines in order to train hospitals, no, regional hospitals to perform this and to see to it na ginagawa nila. Minandate ito ng DOH. And I have to tell you, my dear nurses, that this revolutionized the care of the newborn in the first few hours of life. And based on evidence, this ENC reduced our neonatal mortality rate significantly. Okay, so this is your legal basis. No? Alam kong alam nyo na to, ha? So, eto naman, eto ang hindi kayo masyadong aware of. Tanungin mo nga, yan. Paki-check nga kung alam
Yes,
nila
Doc.
to. Will you ask them sa chat if they know this?
Hindi raw po.
Oh, see, sabi ko na nga eh. Okay, sige. Okay, so that means to say, I will need to, tama lang na I did something here. Excuse me lang for 5 minutes ha. Inom lang akong gamot.
Sure po.
O, ang tanong ng pera, 900 lang kasi may discount. No? I will take my antibiotics and my Sinopret. Okay, hello, I'm back. Ano, Ian, no? So, sorry for that. Pero I'll discuss this more because I have slides on this, no? So, on the latter part na. On the latter part. So, mention means maternal, neonatal, child health, and nutrition. So, bear with me. I'll be discussing this for an overview at the end of the session. Then we have this, no? Administrative Order 12, Series of 2012. Ito, birthing center requirements for skilled birth attendants. Okay. So these are the requirements. Key points. Number 1, a birthing center or a lying-in should be a newborn screen facility. That is mandated. Meaning to say, lahat ng babies doon dapat na newborn screen. Okay? So, dapat accredited yung facility na yon, primary facility to primary facility, accredited siya ng DOH to be able to provide, no? Next, these are the clinical services that a birthing center owned by a nurse or a lying-in owned by a midwife can do. First, prenatal postpartum care, normal spontaneous vaginal delivery for low risk, detection of high risk, then you refer, family planning. It can also be a family planning agency, both for natural and artificial, except surgical, vasectomy, and tubal, and no performance of DNC. You know why these ones are included? Kasi sa birthing center or sa lying-in, one of the requirements is that the nurse has to be in partner or in memorandum of agreement with an obstetrician. So the obstetrician, the partner of the nurse, cannot do this at her setting. And then, of course, the giving of life-saving medications. Sa personnel of the birthing clinic, she should be a skilled birth attendant. That means to say, certified siya na BMO, CMO, and she should know how to resuscitate newborns if they are compromised. And she has a memorandum of agreement with an OB-GYN and a pediatrician at any time that she needs referral. So may partner siya. Bahala na silang dalawa kung paano ang kanilang division of the payment or the cost. This is what I know. Pag normal yan, lahat ng income goes to the owner sa skilled birth attendant. If it becomes abnormal, then the doctor takes over and brings that patient to his hospital of choice where he practices. Then, doon sa provision na yon, administrative order, human waste management is very important. The DENR, local government, needs to inspect, okay, your locality and see where you're going to dispose of your human waste products like your blood, your placenta, and your human waste. Okay? Now, if you intend to have a placental pit, maghuhukay ka para doon ka gagawa ng malaking parang sewerage for placenta that has to be inspected and approved by the DENR. Or meron din naman tayong what do you call this? Contractor that collects placenta like what we have in Faberia. So every morning, this contractor drives the car. Okay, every morning, this contractor sends his truck, a big truck, in order to collect all the human waste that we have, including placenta, and then deposits it somewhere that it is allowed. Okay. Okay. Please focus on Executive Order 141. I do not know if you have taken this, but this is now this is very popular, especially among among women. Never mind. I'll go into the definition. So, Executive Order 141 addresses the root cause of rising number of teenage pregnancies and mobilizing government agencies to implement strategies to address this. So at the level of the barangay. Okay? So alarming ang adolescent pregnancy today, unlike before. The earliest, although before nung time ko, meron na kaming pinaanak na 9.5 years old. But according to the trainees that we are training now, yung last month, nagre-report na yung somewhere in Northern Luzon na meron silang 10 years old and somewhere in the Visayas na meron din silang 10 to 11 years old. So our trainees are already reporting that increasing ang adolescent pregnancy talaga. Unlike before, nung previous, noong Gen X, whatever. No? So, this executive order addresses this concern by, first, sa barangay level, there should be a reproductive health education. So it's up to the barangay how to collect all these teenagers and give health education. But if you read Republic Act 1035-4, naka-stipulate doon na dapat sa elementary pa lang may beginnings na ng health ng sex education. I think grade 4, no? Tapos high school kinukuha na yan. That babies do not only grow on trees. Doon sa ilalim ng punong saging, hindi ganun. That they should be discussed simply and that it should be discussed without any malice at all. And to call the organs, no? Hindi yung flower at saka bird, ay sus, Mariosep. Address them as is. Kasi that's what they do abroad, no? So reproductive health education to teenagers. And then, it's the duty of the barangay at the barangay level, kasi meron tayo din barangay health station, di ba? To look for teenage pregnant women. These teenagers who are pregnant will never come voluntarily for check-up. Hindi. Kailangan hanapin mo sila at dalhin sila sa clinic for their own safety. And functionality of the violence against women and children at the barangay level. What do I mean by this? Kasi even in the Senate, even in Congress, pinag-uusapan na nila ito, no? Anong pinag-uusapan nila? Na any teenage pregnancy is generally a violent pregnancy. Anong ibig sabihin ng violent? Na walang consensus, hindi consensual, na it's either rape or incest. Na walang kamuang-muang yung bata. That's why they are now coming up with harsher, more hard, tawag ito, penalties for men who will violate this act. Okay? Parang gagawa sila ng mas mabigat. Okay? So, functionality of violence against women. And any teenage pregnancy na rini-report will undergo an investigation by this agency at the barangay level. So pag merong naa-abuse na bata, not only sexually yung binubugbog, pinapatiwarek, linulunod na ng magulang, you as a neighbor, okay, can file or can report to this agency at the barangay level so that they can investigate and save the child from further harm. Okay? Okay, so let's talk about teenage pregnancy based on this administrative order. So, teenage pregnancy is defined as children giving birth to children. Teenage mothers are classified as 10 to 14 years old. Tignan mo, nag-cut off na sila sa 10. Early and expected mo more complications. Early and you expect more complications. So ang cut-off natin is 10 already. Okay? And number 2, 15 to 19, late pregnancy late pregnancy na ito, less complication as compared to the early pregnancy. So if the woman or the girl or the child that comes to you is pregnant 5 months, and one of the things that you ask is, ilang taong ka na? Pag sinabing 12 anyos, automatic yan. It is a teenage pregnancy. She should not be attended by you, but it should be attended at the hospital setting. Kasi primary pa yan. And then, these are reported. No? These are reported to the social worker, the SWD, for the VAUSI Violation Act. Okay? Now ito, 15 to 19, sa amin kasi, pagdating mo ng 17 years old to 19, more or less, we already accept you as an adult. But this provision, pag itong provision ang sinight, ito ang inyong cut-off ha. Pero other than, if it is outside the provision, then we take note that 18 is the legal age. Just please take note of that. Okay? What are now the risks of teenage mothers? Anemia is one. Pregnancy-related hypertension or eclampsia. Please remember this, ha? And then childbirth-related complications. I earlier talked about this sa inyong dystocia of the power, the passage, or the passenger, and mental health. Poorer and more prone to depression. So these are the risks of the teenage woman. Okay? What are the risks of teenage mothers giving birth to their babies? So anong risk ng babies? Automatically, we know that babies will be born prematurely. Bakit? Kasi yung uterus hindi pa po siya fully ripened. Hindi pa siya mature. So if it is not mature, then it cannot contain a full-term baby. Okay? So baka 7 months pa lang, 6 months pa lang yan, magko-contract na ang uterus because it has been over-distended. And if that is a preterm, then you have low birth weight, below 5 pounds, below 2,500 grams, okay? Below 2.5 kilos. And if these are the case, no, lalo na sa prematurity, there will be severe neonatal complications. So if it is a teenage pregnancy, generally, we already cue the NICU to come up with their incubators or ventilators. No? So, pag nanganak yan sa primary care setting, itatakbo mo ang bata sa ospital para ma-incubate or ma-intubate. So let's go into the concepts. So I've been talking about OB as equivalent to childbearing. Then it is very unique from other medical sciences because of 3 unique factors. Obstetrical patients are generally physiologic. It has a time frame and it has 2 clients. What do I mean by physiologic? My dear nurses, getting pregnant and delivering babies are part and parcel of uterine functions. Okay? Gestation and fertilization, pregnancy, are part and parcel of the role of being a woman. Okay? Normal po ang magbuntis, normal po ang manganak. You cannot go on sick leave kasi buntis ka. No. But then, in the process of that pregnancy, in the process of delivering babies, pwedeng magkaroon ng complications. So we go into pathologic obstetrics. So, the role of the nurse or the midwife in physiologic OB is assessment. Okay? Assessment, of course. Then, tawag nito, performing procedures independently. You don't need a doctor in order to take the Fundikite, in order to do your healthcare, in order to assess from head to toe. You don't need that. Pero pagdating ng pathologic na, pag na-identify mo na that something is wrong with the pregnancy of this woman, then you become an assistant. You tell the doctor of your assessment findings, and then referral tayo and assisting in whatever procedure that the doctor does. Then we have a time frame. Among all this, ito talagang ginamit ko sa practice ko. Remember what I said? Not more than 24 hours for a woman in labor. Pagdating sa delivery room, the primary should not stay more than 3 hours. The multi should not stay more than 2 hours. Mga ganun ba? Pagdating ng placental expulsion, my time, it should not exceed 30 minutes. Okay? Kailangan within 30 minutes, expel ang placenta. Otherwise, the next 30 minutes, no? Dudukutin ang placenta by the doctor. This is what we call manual removal of the uterus. If after 30 minutes hindi pa lumabas ang placenta, the next 30 minutes, no? So that makes it an hour. No? Dudukutin, may chance pa ang doktor na mangdukot ng placenta manually. The hand of the doctor can still enter the cervix and can still detach and pull the placenta. My dear graduates, take note. If it will take too long for the placenta to be expelled, may nangyari ng ganyan sa amin eh. Pagdating sa amin, yung cervix sarado na, ganyan lang cervix. Ang matatanggap na lang ng cervix eh one finger. Paano mo mailalabas ang 20 centimeter na placenta in diameter? Okay? So, when tinanong, when did this mother deliver? Sinabi niya 4 a.m. and that was already 6 a.m. or 8 a.m. saka tinakbo sa amin. Nagsara na po ang cervix. So we have no choice except to go to the OR to remove the placenta. And the mother was bleeding. Okay? So our rule is within an hour, tanggal ang placenta na yan. 30 minutes for the natural expulsion, another 30 minutes for its interventional expulsion if it is not expelled normally. Please be very aware of the time frame. And then your two clients, you have the mother that can tell you, verbalize what she feels, and the fetus, the more difficult fetus to take care of. And take note, sa OB, you always have to chart or to record on two: condition of the mother, condition of the fetus. And the most important thing na gusto ko lang na makita, if you were my nurse and I'm making my rounds, when I get the chart to look into quality assessment, first thing I see is, does the chart contain an assessment of fetal health? I am looking for the fetal heart rate foremost that was taken by the nurse. I am looking for, kung wala, I am looking for the fetal movement that was recorded by the nurse, or I am looking for a diagnostic procedure that was charted by the nurse na in-undergo ng fetus, like an ultrasound, a biophysical profile, a non-stress test, etc. It should always be present. Kung wala yon at may nangyari sa patient, naku, kasama si nurse sa negligence. Okay? So that's how important these things are to the maternity nurse. So points to remember. Ito yung mantra natin ha. All women are at risk at childbirth, no matter how complete the prenatal visits are. The main goal of the prenatal visit is a healthy pregnancy for the healthy mother and child, for a healthy mother and child. So, these are data, maternal mortality rates, rate data from 2000. Look at our statistics. Our MMR was 2009, in 2006, 162, in 2012, umakyat sa 221, in 2015, 127, in 2017, 121. I think our current rate is 114. Still, the Philippines is recording a 3-digit maternal mortality rate, which is very, very poor. We are the second country in Southeast Asia with a very poor maternal death rate. Ang unang poorest is Indonesia, sumusunod si Philippines. And it is very ironical kasi tayo ang nagpo-produce ng maraming healthcare providers. We provide the world with nurses, midwives, and doctors. And yet, mothers are dying at our own backyard. Ironic. Lalo na ngayon, estudyante pa lang hina-hijack na ng mga global countries. So mas maraming mamamatay. Okay, so we are working hard on this. So because of this and the poverty, pumasok ang MDGs, alam nyo na yan, di ba? So eto lang yan. Okay, just for your review, poverty and hunger, etc., etc. So from the point of view of health, we have MDG 1, addressing hunger, which is malnutrition. We have MDG 4, which is child mortality. We have MDG 5, which is maternal health. And we have MDG 6, which is HIV. HIV again is has an alarming data sa DOH. Alarmingly increasing ang ating HIV cases. Again, DOH is telling us to triple our efforts, no, to teach our young, kasi mga bata ito no, to teach our young for safe sex, and so reproductive health na naman na education ito. Okay, so dito sa hunger, okay, look at this statement. If only mothers are exclusively breastfeeding their babies for 6 months, no baby will go malnourished for 6 months. Lalo na kung 2 years siya magpapa-breastfeed. So breastfeeding has a very, very big influence on malnutrition. Babies who are breastfed are rarely malnourished. Even if the mother is malnourished, well, the milk that the baby gets from the mother is still very much effective. Okay, then you have your child mortality. By the way, this MDG ended in 2015, and in 2015 also came the next level of sustainable development plans, which I will take up in the latter part of my session this morning. Okay, sige. So let me go now to information. The status of maternal health every day in 2020. This is a data taken February 2023, latest. 810 women died from preventable causes related to pregnancy and child health. My dear nurses, maternal mortality deaths, okay, are generally 98% preventable. Okay? So kung sana ito nagpa-check up lang ng maayos o magaling lang ang attendant na nagpaanak, walang problema. But look at this next statement. Between 2000 to 2020, the MMR dropped by 34% worldwide. Bumagsak. That means we're getting there. Pero ang mahirap, 95% of all maternal deaths occur in low and lower middle income countries, kasama si Pilipinas. So, what are pregnant women dying from? What are they dying from? Automatically per standard I say severe bleeding, pero itong latest na ito states that medyo nag-e-edge na ang pre-existing medical conditions prior to pregnancy. So this one, halos pareho na sila. Okay? So if the mother is sick prior to becoming pregnant, that can kill her because the pregnancy will aggravate her condition. The labor and delivery will aggravate her condition. Okay? So what are we saying? Utang na loob. Prepare for pregnancy, which I will discuss in the next slides. No? Okay. Now, the next is severe bleeding. Next is preeclampsia. Next is infection. And infection is mostly after childbirth. By the way, the preeclampsia is generally in pregnancy. Severe bleeding is generally post-childbirth, right after delivery. And then you have, of course, obstructed labor. Ano ang obstructed labor? Dystocia, hindi makalabas ang bata, maliit ang sipit-sipitan, o malaki ang bata. Then we have abortion. Why abortion? Kasi po, abortion is still not legal in our country. So madaming mga babae na nagpapa-abort clandestinely sa labas. So therefore, they die of infection coming to us, or they die of bleeding. And of course, blood clots. So on the other hand, dito naman sa ating babies, the number one killer of our newborn, eto si newborn, is still prematurity, followed by asphyxia. Asphyxia is childbirth related, and then infections. Tetanus kasama, congenital anomalies. Okay? So eto tayo, ha? Iyan lang ang gusto kong i-emphasize dito. Kasi sa prematurity, the maternity nurse is part and parcel. What do I mean by this? We try to prevent premature births as much as possible. And the maternity nurse can be a factor in preventing this. No? The maternity nurse can refer immediately any woman in danger of preterm birth. The maternity nurse can monitor a woman with tawag nito, tocolytic agents to prevent contraction. The maternity nurse can inject steroids in order to enhance, okay, surfactant level so that the baby will not die of RDS. So malaki ang role ng maternity nurse sa prematurities. So what limits the access to quality healthcare? Tatlo, I'm sure you've heard of this. The 3 delays of safe motherhood. What are they? Delay in seeking care, delay in reaching the appropriate facility, and delay in receiving appropriate care. My dear nurses, these are all WHO given data, and this is global. So, anong problema usually? Bakit delayed ang pagdadala? When in our ER, the midwives that would usually refer their clients are generally delayed. They come to us when the mother is almost dying. So I do not know kung na-recognize ba nila ang danger sign o ayaw lang nilang pakawalan yung nanay. And then also on the part of the family, lack of money. Wala silang pera kasi ang kaya lang daw nila lying in. Ang kaya lang daw nila is community setting. Hindi daw nila kayang ospital. And that is why it's very important to tell them about the PhilHealth package. Now, delay in reaching the appropriate facility, walang masakyan, malayo ang bahay is the most common. Then delay in receiving appropriate care, okay? Pwedeng lack of competence of the healthcare provider, pwedeng walang supply. Darating sa inyo, nagdudugo, ano pang gagawin nyo? Wala namang supply, wala namang BTS, blood transfusion set, wala namang blood. And so they die. So as I said, these occur in low and in lower countries, no? Economic status. Okay, so this is our Sustainable Development Goals. Alam kong nakita nyo na lahat yan. So, yung 4 na goals ng MDGs napunta na lang sa isa, which is your goal number 3, which is for good health and well-being. So, these are the goals within the goal. So, in goal number 3, ensure healthy lives and promote well-being for all ages. Yan ang goal number 3. Now, on the left aside is the target for maternal mortality. Our target now is to have 70 per 100,000 live births. By the way, maternal mortality is defined as the number of maternal deaths per 100,000 live births, hindi stillbirth. Hindi kasama ang stillbirths or IUFDs. So, ang target natin is 70. Sa MDGs, our target was 52. Hindi kaya. So we are still at 114. So ang layo pa ng ating tatakbuhin. And the aim of the SDG is no country should have an MMR of 140 per 100,000. At least ito na carry over na natin. Now, to the babies, ito yan target, no? Reduce neonatal mortality rate to at least as low as 12 per 1,000 live births. Okay? At least at 12 per 1,000 live births. I think we are at 17. So malapit na tayo. We're good. At saka yung under 5, ha? Merienda? Meron ka doon. Sabi. Uy. Meron ka doon buko. Tapos meron ka doon yung butterscotch. Okay? So you have there under 5, reduced under 5 mortality to at least 25 per 1,000 live births. My dear nurses, please take note. Pag babies and children ang pinag-uusapan, your denominator is 1,000 live births. Pag mothers ang pinag-uusapan, your denominators would be 100,000 live births. Although WHO can also do it at 10,000 live births. Pero the standard being used by the Philippines is 100,000 live births. Okay? Okay, so this is the maternal, neonatal, child health, nutrition strategy. Intermediate goals. Ginagawa natin ito. So number 1 intermediate goals in order to reduce maternal death is that every pregnancy is wanted, planned, and supported. Kung lahat ng pagbubuntis, plinano, drastic ang reduction ng maternal mortality and morbidity. Example, pag diabetic ka, you want to get pregnant, plinaplano mo, then control your sugar before getting pregnant. Okay? Kung may heart disease ka at plinaplano mong mabuntis, then see your cardiologist and let him assist you in the course of your pregnancy and childbirth. Okay? So ayan ha, if the pregnancy is not wanted, number 1 na pwedeng gawin ng mga babae, magpa-abort illegally. Okay? And so they are more at risk to dying. So what do I say? Lahat ng magbubuntis dapat pinaplano, and WHO has recommended an interval of 3 to 5 years. 3 to 5 years interval so that the uterus and the well-being or the health of the woman can recover from the previous pregnancy. So makokorek ang anemia, ang uterus, magre-rest ng 3 years para maka-function again. Okay, excuse me ha. Okay. So ayun na. Next strategy. Every pregnancy is managed. That means if you want the pregnancy to be at a lower risk, have a regular prenatal care check-up. Okay. Then next is every delivery is facility-based. This is discouraging home births na and managed by skilled health professional. Hindi na po nire-recommend ang hilot. Okay, drenap na ang hilot, no? They are not professionals, so being handled by a hilot will be more at risk for the woman. And then every mother and newborn pair secures proper postpartum and postnatal care. So the mother should be come for you for checkup as well as the baby. So if these intermediate goals and strategies are followed, less and ang ating mortality, ang ating maternal mortality and morbidity. How will we make this happen? A skilled healthcare professional attendant for every childbirth. This is the safest. If you want your delivery to be safe, sabi nila, a skilled healthcare professional should do it. Every woman has an access to IMONG or Emergency Obstetric and Newborn Care, a facility that can provide cesarean, a facility that can provide blood transfusion, and family planning services to help women space their pregnancies. Okay, so this is, I believe, is what is not being discussed in most of the lectures. So this is our Menchan Service Delivery Network, transportation. So this is their delivery referral system. At the bottom, at the biggest level is the community level, service provider, community health teams. Ano ang function? Pregnancy tracking, birth planning. So puro health education, home visits and follow-up, nutrition package, support, IEC, cha-cha-cha, cha-cha-cha, cha-cha-cha. So there are no interventions at this level, but information, education, and communication at this level, including pag meron tayong immunization dito na rin. Immunization, breastfeeding, feeding programs, etc. Dito na rin. Now, the second level is the BIMONG facility, and this will consist of the district hospitals, the rural health units with SBAs, the private lying-in clinics. What are the functions? Normal vaginal birth, imminent breech delivery, emergency drugs like mag-sulfate, antibiotics, oxytocin, dexamethasone, ENC, basic newborn resuscitation, and family planning services. And at the top of the triangle is the CMONG, supposedly the end referral facility. Ano ang meron nito? This will include provincial hospitals, medical centers, etc. BIMONG services plus blood transfusion, cesarean section, advanced newborn resuscitation. Anong ibig sabihin ng advanced newborn resuscitation? Intubation. Okay? Operates within 24 hours with an OB surgeon, pedia nurse, midwife, and medical technologies. Meron pang hindi nadagdag dito, and your anesthesiologist. Okay? So this is our delivery system. Ngayon, ito na ang bago. Ramcham. So from the Menchan 2008, nag-progress ngayon ang DOH, WHO into the integrated Ramchan. From Menchan to Ramcham. What is Ramchan? Okay, reproductive, maternal, neonatal, child, and adolescent health and nutrition. So anong dinagdag? Letter R. So reproductive, what does this mean? Kasama na po ang men, hindi lang babae. So reproductive, kasama na ang lalaki. And letter A, kasama na ang adolescent sa child. Sineperate na because of adolescent pregnancies. And so, Filipino women and men achieve their, Filipino women and men achieve their desired family size and fulfill reproductive health and rights for all through universal access to quality family planning information and services. Then dito, every pregnancy is planned, wanted, supported. Every newborn infant and child are provided with age-appropriate essential health and nutrition care packages. Adolescents are informed and guided on health matters, particularly reproductive health and nutrition services. Remember, ang sa adolescent, erratic ang diet niyan, ha? And finally, every adult has access to correct and adequate information and guidance on reproductive health services, including family planning and protection from violence against women and children. So yan ang latest ngayon from Menchan to Ramchan. Okay. So tapos ang aking first part. So any reaction? Iyan.
Hello po.
Yes.
May question po rito, Doc.
Hmm.
Is it normal po ba na may tissue na kasama sa first menstruation po?
Ah, yes. My dear, these are endometrial tissues. If you look at your menstrual flow, if you look at your pads, merong liquid part, merong solid part. The solid part are your tissues. Nakuha nyo? Normal siya. Huwag kayo matakot. Hindi yan bata. No? And kasama rin doon ang unfertilized egg. Okay? So, yung mga solid parts na yan are yung mga extra endometrium na dapat naging desidua kung nabuntis. So, since hindi nabuntis, mag-shed off lahat yan. Okay? Hindi titigil hanggang hindi matanggal lahat yung extra endometrial cells na yan or tissues. Okay?
Next question po, Doc.
Ang dami yata, hindi na ako pupunta sa part. No, I'll have 15 minutes for the partograph. Sige.
Yes po. Mataas po ba ang chances ng obese person na magkaroon ng PCOS?
Oo, isa yan sa sorry. I'm sorry to those medyo overweight kasi nakakasakit ng kalooban na masabing mataba sila. Pero these are those at risk for PCOS, no? Yung mga matataba, yung mga medyo muscular, yun ang mga So, eto nga number 1, pag pumunta ka sa fertility clinic namin at nakita ka ng doktor, sasabihin ka agad ng doktor kung malaki ka, magpapayat ka nga, hindi ka mag-o-ovulate pag hindi ka pumayat. Kasi yung ovaries mo nababalutan ng fats, nababalutan ng follicles. Okay? So, kaya nga, pregnancy must be planned. If you intend to become pregnant, start fixing your body. Okay? Pag irregular ang menstruation mo, ayusin mo na. Pag may PCOS ka, magpa-under management ka na. Okay? Pag may STD ka, magpa-treat ka na. So these are the things. Pag ikaw magparogam ka na to prevent blood incompatibility. Magpa-vaccine ka na mga MMR and all. Okay? So that is a way to make your pregnancy safe. Plan it and do something para ma-reduce ang incidence of risk. Okay. Sige. Lana? Nanahimik ka? Ba't nawala ka?
Ayan po. Last question po. Okay lang po bang magpa-vaccine ng wait lang po. HPV ang lalaki?
Ang lalaki?
Ang lalaki, yes.
The vaccine, I'm sorry, but the vaccine was made primarily for women. Okay?
So, bawal daw po ang lalaki?
Hindi pa, wala pa akong na-encounter na we're talking of anti-cervical cancer, no? Vaccine. Tama? HPV yan as the cause. Kasi anti-cervical vaccine is only for women. Kasi silang nagkakaroon ng cancer of the cervix. That's how I get your question, Iha, or Iho, or whoever. Now, kung may HPV ka and you are male, then you will be treated like a sexually transmitted disease. Nagets mo? Oy, iyan.
Yes po.
Buhay ka pa?
Apo.
Okay. So,
HPV vaccine po, yes po.
kung HPV yan, ang problema mo, okay? Pero pag you are looking at targeting anti-cervical cancer that is caused by HPV, then sa babae lang yan. Sila lang ang may cervix, iyan.
Okay.
Okay? Okay? O can I go ganito? Kasi I just got it from you, no? I just got it from you, ano? Hindi ko na prepare yung aking slide, so I will have to go out of the laptop and come in later for my slide in Partograph. Okay ba, Ian? Mag-a-out ako, clear?
Mhm.
Tapos i-prepare ko yung slide ko and then accept mo ko, ha?
Sure po, Doc.
Okay, okay. Kasi katulad niyan, no, based on what we asked kanina, Partograph seem to be not a very very informed topic. Okay? So, I'll do the Partograph slides, okay? Yung suturing, wala naman tayong perfect na suturing na slide or what that will take a longer period, but I'll go into the Partograph. Doon lang sa mga what you call this, basics na dapat malaman. So I'll leave muna, then come in, ha? Okay. Ayan ha, hindi nyo ako minumute. Unmute. Iyan.
So, hi, Doc.
Yeah. Sige, can you see my screen?
Yes po, Doc. The partograph.
Sige. So, hello.
Okay na po.
Sandali, nag-i-stop subtitles ako. Okay. So, can you see? Okay
Yes
na
po.
tayo? Okay. So, I will run fast. I will run fast ha, kasi may background na naman sila. So, let me go into the partograph. Okay, so alam mo naman to this is the DOH training module that we use. So the partograph is a record of all observations made on women in labor. Please take note, the central feature of which is the recording of the cervix as assessed by IE. So ang pinaka-center is the graph on cervical dilatation. Now, you cannot do the partograph unless you have the basic tool of performing vaginal exam or IE. Okay? So IE lang, wala nang iba. So this was formerly, ito ang partograph natin. If you see it, Ian.
Yes po.
Okay. So this is our partograph, no? So you have here the green area, which is the normal expectedly, and the alert area, which is the yellow or the alert caution area, and the red area. So ito siya. So this is the central graph, and these are the findings that you can only write every time you perform your IE, or you take the heart rate, or you let the woman void, or you take the vital signs, etc. Sinusulat lang lahat dito. Ang grinagraph nyo lang will be the status of the cervical dilatation. Okay? Okay. So here, parts of the partograph, we have the graph and the maternal and fetal well-being down. Okay? So, ang OA, the progress of labor is written, and maternal and fetal conditions are seen and written down. Now, if you look at this graph, okay, you have two oblique lines here. This first line is what we call the alert line. And 4 hours, 4 hours from the alert line, 1, 2, 3, 4. 4 hours from the alert line will be your action line, which is the second oblique line. So the action line is seen prior to the red area. Now the rule is, if the symbol X, which is the cervical dilatation, is on the alert line, and going to here, going to the green line, that means labor is satisfactory. But once it passes through the alert line, the midwife or the nurse must be doing something else, and already contacting transport services or transporting the patient. Okay? So what are the things that the midwife or the nurse can do? The midwife, kasi mas matapang ang mga midwife talaga dito For as long as the bag is intact, the midwife can ask, or the nurse can ask the woman to move around, stand up please, and to void immediately in order to give more space for the head to descend. But then, pag ganyan, no, kaya nag-i-slow down na siya, then yung prepare na nila ang transport services. Once it has reached this action line, kung naka-X ka dito, kailangan that woman must be in the hospital setting ready for any operative procedure. Now, if you take note at this graph, the partograph begins during the active phase beginning 4 cm. Okay, and The boxes going up will be 1 centimeter up until 10 cm, which is the fully dilated cervix. And the boxes going to the right side will be the boxes for the time hours spent, or the time, no? Hours spent by the woman in labor. So dito nyo ilalagay kung if you do the IE every 4 hours, so dito nyo ilalagay. So this is 1, 2, 3, 4. Repeat nyo na naman dito. Ganon. Okay? Okay. Now let me emphasize, these are not the conditions that should be done, no, for partograph tracing. One, you do not do a partograph for high risk or abnormal cases like bleeding, preeclampsia, fetal distress, previous CS, multiple pregnancy, very premature baby, and obstructed labor. Because, my dears, we know very well that these conditions are at any time due for abdominal delivery. You cannot anymore afford to monitor the progress of labor at any time, no? At any time, minutes even, no? They can be liable to be brought to the OR for an abdominal delivery. So fetal heart rate is recorded hourly. Okay, this is usually a favorite question. On liquor amniotic fluid is also known as liquor amni. By the way, with an O here, that means this is a British derivative. Liquor amni is amniotic fluid. Every time you do an IE or a vaginal exam, you always take note of the condition of the amniotic fluid. A means absent, ruptured siya, pero walang lumalabas. B means ruptured siya, pero bloody. And pag bloody ito, you consider possible abruptio placenta or even a low-lying placenta previa. C for ruptured, pero you see it, pero the fluid is clear. M for meconium stained, which means distress. And I for intact, hindi ruptured ang bag. Cervical dilatation is the most important, assessed at every vaginal examination with an X as a symbol, and plotting begins at 4 cm. Hours refer to the time elapsed since the onset of the active phase of labor. So time is the actual time of day it is recorded. So contractions are recorded every hour. So in every hour, how many contractions occurred? What you do is just test contractions for 10 minutes. How long? And how long do they last? Okay. And what is the duration? And then you write it on the space provided for sa partograph, like 3 per 10 minutes, 5 per 10 minutes, ganon. So 10 minutes lang kayo every hour na magta-time ng contractions. So oxytocin drugs are recorded in the space provided. Monitor every 4 hours, okay, because you do the partograph on normal cases or physiologic cases. So you can do your routine care more frequently if indicated. So kung gusto mo, sometimes ako noon, instead of waiting for 4 hours, I would take my vital signs every 2 hours if I feel na medyo bumabaliktad na ang condition ng aking patient. So urine must be recorded, okay, every 2 hours, because a full bladder can retard the descent of the fetus. And please test for protein and ketones. Protein for the possibility of preeclampsia and ketones for the possibility of dehydration. So tignan nyo na, baka kailangan ng mag-fluids ang nanay. Okay, so the appropriate use of the partograph is expected to reduce the incidence of prolonged labor, reduce the incidence of emergency CS, reduce the incidence of stillbirth rate, because you're able to arrest the death of the baby right at the time when it is so. So, ito yung sinabi ko, if the partograph passes the alert line, okay, reassess the woman, alert transport, empty the bladder, hydrate the mother, but please omit solid foods for possibility of anesthetics, encourage the upright position and walking, and monitor intensively. If no progress, takbo na kayo. Okay? If the partograph passes the action line, refer to an imong facility unless imminent na ang delivery. What do I mean by imminent? Crowning na, ayan na ang ulo. So, position the woman, deliver if it is imminent, no? Inject oxytocin after the delivery, okay? And watch for vaginal bleeding. If a woman is admitted in latent phase of labor less than 4 cm, record only whatever is needed to be recorded, not specifically the dilatation. If she remains in latent phase for the next 8 hours, this is prolonged. Transfer her to the hospital. So let us try to record the findings in the partograph. Begin by plotting the cervical dilatation on the alert line. Plot only the cervical dilatation using the symbol X. Start when the woman is in active labor, 4 cm and more, and contracting adequately. How do we know that labor is progressing? The cervix is progressing. Pagkatapos, ang second ninyo is contractions are regular incoming. There are 3 to 4 contractions in 10 minutes. So this is a sample, no? So mag-sample na tayo. Ayun. So that means to say, if I plotted X dito, that means to say, I admitted my patient at 5 cm cervical dilatation. I admitted her at 9 a.m. So dito ko linagay. If you notice, dito sa line ko linagay because this is the beginning of the next hour. That means to say that that woman has been in labor for at least an hour prior to admission. Okay? In active labor. Next is, okay, so 9, 10, 11, I decided to do an IE again and I got a 7 cm. Hindi ko siya iplaplat dito. Iplaplat ko palagi siya dito. Okay? So, look at this. Yan. So 12 p.m. is the time. So I write the time here and from here, I go up, up, up until I take 7 and put my X there. Ayun. So hindi ko siya dito plinat ko siya sa alert line. Okay? So ito yung una, 4 p.m. ko ginawa ito. Again, I plotted on the alert line. Example lang to ha. At 8 p.m. after 4 hours, so 4, 1, 2, 3, 4, ito siya. I will do my IE again. I got an 8 cm, so dun ko plinat again. Ito si 8 cm, plinat ko siya, and then idudugtong ko siya. At 10 p.m., after 2 hours, anong nakuha ko? Ayun, 10 cm na. So I write it there sa 10, opposite sa alert line. And then, dugtong ko lahat. Ayun. So, these are the result of my IE. How many times did I do the IE? I did it 3 times. Okay? And where did my X stay? My X were plotted on the alert line all the time. So what is my assessment? Normal ang kanyang labor. Okay? (7 a.m.) So interpretation ko at 7 a.m. I did my IE and I found out that the result is 5 cm. So the case is this. G3P2 is being monitored. Her initial IE at 7 a.m. showed 5 cm. So dito yan. Okay. Next, at 11 a.m., another AE was done and showed 9 cm dilatation. So 11 a.m., 1, 2, 3, 4. 11 a.m. Pupunta na ako ngayon sa 9 dito. Okay. Ayan. Because that was my findings. Okay. At 1 p.m., the patient had a fully dilated cervix. So, 11, 12, 1. So, fully dilated, dito na yan. Ayan. Okay? And then, I connect. Ayan. Even if the X traversed the alert line, labas ng baby, okay na to. So still, this is a good example. So this is a good example of a normal birth. So deviations, okay. Progress of labor is normal if plotting stays on or to the left of the alert line. So these are normal. Okay. Dali. Nagluluko. Okay. O, ito ng example. Okay. Plotting that passes the alert line, yellow part, more so if it reaches the red part indicates abnormal progress of labor. Now, the beauty of the partograph is it is visual. So you do not need to be a summa cum laude to be able to interpret. Kahit sino makakakita nito. Pag nakakita ng, sabi mo lang, pag lumagpas dito ha, takbo na natin. Alam na, more or less aware na sila that the case is getting abnormal. So these are your, this is where you're going to plot, no, whatever findings you see. So these are examples. So medyo nagkaroon siya ng problema at 6 a.m. That is why inulit after 1 hour yung IE, finally 10 a.m. 10 cm na. So this is okay. Now sometimes fully dilated pero ayaw lumabas. Then the doctor can do a forceps extraction, assisted vaginal delivery, forceps extraction, or a vacuum extraction for as long as fully dilated ang cervix. So this is an example of an abnormal partograph, no? So 9 a.m. by 12 noon 2 cm pa lang. I mean, by 12 noon 1 cm pa lang ang tinaas. Ay Diyos ko, talagang iba na. By 2 p.m. another 1 cm, very very slow, non-progressive labor. Yan, ilabas nyo na. Okay. So case number 3 is okay. This is an example. This is another example of a problem. Okay? At this point dapat tinatakbo nyo na yung baby because nag-a-alert line na tayo. Baka bumitin ang ulo dito. Okay? There is no vaginal bleeding, intact ang bag, 140, 88 Then clear, nag-rupture na siya. Contractions per minute, per 10 minutes is 3, 140, 88, etc. Okay. So this one is very bad. Okay? So at 5 p.m. admission, intact ang bag. At 9 p.m. intact. By 1 a.m., ruptured ang bag, meconium stain. That means to say ng meconium stain, fetal distress. Okay? So 3 contractions, hindi na nila tinignan. The temperature was elevated at 1 a.m. The pulse rate increased at 92, although the BP was still normal. Still, at this point, we are preparing this case for a possible cesarean operation. Okay? Sige. Ayan. Ayan lang ang overview. Where are you all? There you go. Any questions? Iyan. Bakit ganito yung kanilang mga ulo nila lahat? Puro avatar. Yan. Any question? Any feedback? Puro avatar kayo, ha? Nawala na si Ian.
Hi, ma'am.
Peds, nawala si Ian.
Yes po. Ma'am, based po sa chat box natin, wala pa pong nag-raise po ng concern or question
Very
po.
good. Oh, so we can end. Tama ba tayo? Can we end? If there are no questions. Anyway, I'm back tomorrow. I can answer the questions in case. Puro ano okay. So, thank you so much. Oh, si Alrich, do you have any question? Tumaas ang kamay mo. Kita na kita. O,
Mukhang
ano?
wala naman po silang tanong, Mami, at nasagot naman po nila lahat.
Oh, very good.
Po, puro thank you po yung message nila. Thank you po.
Meron ako dito, doktora. Ask ko lang po if ang lubricant can be used as birth control. Kasi po, nabanggit sa intensive na parang ang lubricant nagpapakil daw ng sperm. So, hindi daw po advisable nung gumamit yon if you are trying to conceive. Oh, okay. Well, ang lubricant, ito lang ha. Let us go into the word lubricant. Ang lubricant, my dear, is being used to assist in sexual intercourse. Lalo na pag hindi masyadong stimulated or hindi wet masyado at nagda-dry na ang vaginal canal, usually lubricants are being recommended. Okay? Pero to say that it can kill the sperms, no. Ang ibig lang sabihin nito siguro ng lecturer nyo is it is used as a spermicide. Spermicide, di ba? Or backup. Backup yan, okay? If you're going to use lubricant only for birth control, it won't do its job. We use spermicides, not lubricant. We don't call it lubricant, no? We use spermicides as a backup for other methods, especially if the woman is in her fertile period and we do not want a pregnancy. Clear? Ito lang ha, there is no absolute family planning method. The only method that will stop conception is abstinence. Sabi na naman, paano naman yan ma'am? Kaya nga ako nag-asawa to be able to enjoy my right. Ganito lang yun. Use a method, but during your fertile cycle, use a backup method or abstain from intercourse. Nagets nyo? For example, kasi alam nyo ba, my dear ladies and gentlemen, meron kaming 3 na cases na na-ligate pero nabuntis. Ligated na ha, buntis pa. Pag talagang, ay nako, believe ako talaga sa kanyang power. Kaya you really don't want to get pregnant, kaya ka nagme-method. Then, look at your cycle. Pagsamahin mo ang natural at saka ang artificial. Naka-method ka, naka-pills ka. Kung ayaw mo talaga, look at your cycle. If you are wet and you are fertile, abstain. Nakuha nyo yung point ko? Well, that's what you get for really trying to get your outcome. So, bawal ba ang lubricant if you're trying to conceive? Hindi naman. Basta wag lang siyang spermicide. Are we clear? I hope Jillian, I hope I am able to answer. Okay? O anything else? Alam mo, nagbabasa ako ha. Kahit papano marunong ako magbasa.
Doc,
Mas,
meron pa po isa rito, Doc.
saan?
Sir, pwede po patanong if pumutok na po yung panubigan ni mother, ano po first gagawin ng nurse if ipoposition po to left side, test amniotic fluid using nitrogen paper or assess FHR po. Iba-iba po kasi para nangihingi lang po siya kung ano po talaga.
Okay, alam ko na yan. Ang point dyan is what is your priority? Okay? Kasi lahat yan gagawin mo eh. Gagawin mo lahat yan. Okay? Ngayon, usually, ano yan eh, sequence yan, sequence. Usually, number 1, ha? Pumutok ang bag of waters. Number 1, position mo na. Number 2, heart rate. Number 3, natrasin. Nagets nyo? Kasi i-position mo na siya na mahiga kasi you are preventing the Number 1, how can you take the heart rate kung hindi naman nakahiga? Tama? Kaya pahigain mo para makuha mo. Pangalawa, you are putting the woman in a left side lying position primarily to avoid prolapse of the cord, which is a dangerous condition. And then, so linagay mo na. Now, after naka-left side na yan, i-check mo ang heart rate. Why? Why would you check your heart rate? Para malaman mo the condition of the fetus. Kasi kung yan may prolapse or what, makikita mo na yan sa distress ng fetus. Ano yan, tataas ang kanyang heart rate. And then, yung nitrogen test, if you just want to see whether, yung nitrogen test is insignificant eh. Kasi ang tawag to amniotic fluid tayo eh. The fact na pumutok, mo, you assume amniotic fluid na talaga yan, which is true. Pangalawa, hinartrate mo kasi ruptured na, bakit mo pa inanitrasin? Unless you want to validate na talagang what you saw is amniotic fluid. Okay? So kung ako yan, especially nursing task, okay, ang point ko dyan is, pahihiga ko muna. Kasi how many seconds lang naman ang pahiga bago ko makuha yung heart rate. Unless nakatayo siya, naglalakad, hina-heart rate ko. It will not be reliable. Okay? Ano pa, Aldrich? Walang time frame lang ang pinag-uusapan natin dyan. But the heart rate is most important para malaman mong buhay o hindi. Pero kailangan nakaposition yung nanay. Okay, next.
Isa pa po, at risk po ba for cervical cancer if maaga nag-start ang menstruation po?
No. Walang relation. Cervical cancer, okay. Walang relationship sa menstruation. Ang nakikita kong relationship sa cervical cancer is sexual intercourse na maaga ng iba't iba. Okay? Yon. Menstruation sa cervical cancer, wala. Pati nga yung there is what is being related to menstruation. It is breast cancer because of estrogen. Ang sabi nila, pag late ka daw na nagmenopause, okay, then the tendency to breast cancer is higher or at risk. Doc, at risk po ba yan ng infection po if the bag of water pumutok na po tapos once year? Oo, basta nag-rupture ang bag, kahit konti lang, at risk na yan for infection. At risk na yan for infection. So pag nag-rupture ang bag yan, usually ang tawag nito, tinetest na namin talaga yan for possibility. Basta rupture ang bag, at risk for infection. Chorioamnionitis. Pag PROM yan, nag-rupture before labor, automatic yan. Antibiotics na kami. Massive. IV push. Okay? No, hindi irregular ang mens if 1 to 2 days lang nadidelay. Hindi. When I say delay, irregular, that means you know your cycle. My dear ladies na narito, as nurses, you should know your bodies. You should know your cycle. So alam mo na ang cycle mo is either 26 days or 30 days. Yun. Ngayon, kasi kung minsan ang cycle mo 26, ang next cycle mo 28 ka, hindi pa rin. Basta dumarating yan per cycle. Ha? 1 to 2 days will not matter. Ala, because nag-duty po ako tapos nag-rupture na po pero pinalakad. Ay naka, risk ka. Never mind. I don't want to comment. Ha? Hindi dapat. Basta ruptured ang bag, usually, higa ka na iha. Ha? Okay. That is the standard. Ha? Kung pinaglakad ka, risk na yan kung sinong nagpalakad sa'yo. And if you are a nurse, you should refuse. So you tell them, I will sit down and lie down because I know I am and my baby are in danger. Okay? Ito, meron po yatang manufactured, pero that's why nga, that is why I said, kung lubricant lang na hindi spermicide, okay siya. Pero kung nakalagay naman na spermicide, abay hindi. Oh, very good. Bermudez Harvey. Okay, very good. Okay. Grabe naman na sperm naman. Ay, talaga. Ngayon, nung araw, 1 sperm to 1 egg lang. Aba ngayon, 1 sperm to 2 eggs na. Alam nyo ba yan? Oh, how do we know this? Evidence-based, no? Researches, no? Oh yes, yung mga ligated. As I said, walang 100%. Abigail, ha? Walang 100%. Tatlo na ang naligate namin na lumabas, na dumating, bumalik sa amin buntis. Anong ginawa namin? Libre lahat. And then, we had to open, no, cesarean. Nung binuksan namin and inspected the fallopian tube, ganyan yan eh. Alam mo, nag-recannulate. Nagdugtong uli yung pinutol namin na ismus. So there is still a possibility. Okay? Kaya huwag kayong open sesame palagi, ha? You should know your bodies. Kaya nga eh. Okay.
Doc, may question po.
Yeah.
If pumutok na po yung panubigan ni mother, ano po first gagawin ng nurse? If i-position po to the left side, test amniotic fluid using nitrazine paper, or assess FHR po?
Dalawa lang yan. Ang tawag dito. Lahat yan pwede, as I said. Anong tanong first na gagawin?
Yes po, Doc.
Alam mo, kung talagang isi-sequential mo, lie down. Pero kung ano mo yan, according to how do you call it? According to, ano yan? Importance, heart rate yan. Nitrazine test, bakla yan, in between yan. Are we clear? So, kung ako ang nurse and I want to test the status of my patient, heart rate ako. Pero, as I said kanina, how can I do it kung hindi ko pahihigain? Kaya kailangan anuhin mo ng husto yung question. What is the initial action? Or what is a significant action of the nurse? O iba yon. Pag initial action, pahigain. Pag significance and etc., heart rate ako kasi buhay yon. Okay?
And then meron pa po, Doc. Okay po ba kung parang 3 times ka na nag-mens in 1 month?
Hindi,
Yung first,
hindi. No, sasabihin ko na hindi. O sige, tuloy mo, iyan.
ayan, yung first nasa 5 days naman po, parang regular lang. Then
Yeah.
after a week po, nagkaroon ng spotting.
3
days po. Then bandang last week ng month, nag-mens po ulit.
Yung spotting na yon, baka naman dovetail, PS. Alam mo yon, PS. So kung ako yan ha, titignan ko muna yung next. Hindi ka agad ako magko-conclude. I have to assess. So kung ako yan, sinabi mo yan sa akin, o sige, balik ka sa akin with your notes kung kumusta. Kasi pwedeng, tapos at the end of the month, pwedeng nagpanghabol lang eh. Tapos yung 3 spotting na yan, pwedeng pahabol. Nagets mo? So kung ako yan, hindi ako mag-a-conclude kaagad, titignan ko muna yung 3-month cycle mo. Okay? Doc, nai-infection po ba kahit never nakikipag-sex? Oo naman. Your panties, the way when you flush, etc. Yung mga bathing suit nyo na hindi nyo pinapalitan kaagad-agad dahil nagpapa-post-post pa kayo sa pool. Oh, dapat kasi once na naka-swimming kayo, automatic change your wet undies. Eh hindi pa eh. Maglalagay kayo ng sarong, pagkatapos ikot-ikot sa pool, makikipost ng ano, etc. O ayun, hanggang sa umakyat na lahat ang infection. That's another because we have to accept it. Madumi ang pool kahit na may mga chlorine dyan. So kahit hindi ka pa, hindi nakukuhang infection only sa sex. It can be self-inflicted. Pag nagwash ka with your dirty hands, no? It can also be inflicted. Okay? Kung yung undi mo at 12 hours na, do you know that we are recommending to change undies every 4 hours? We're recommending that, lalo na kung nasa wet period ka, change your panties or use panty liners pero change it every time you go to the CR. Palitan nyo. Huwag nyong gamitin yung panty liner na yan. Pag ginamit mo the whole 8 hours na nag-duty ka, can inflict infection. Hindi ka nakipag-sex nun. Clear?
Ito po, Doc.
Oh.
Ano po gagawin kapag anemic po tapos may prolonged menstruation po like 3 weeks po?
Uy, alam mo, eto hindi lang this is what we advise to women who are menstruating. Take iron capsules or tablets. Every time na mag-menstruate kayo, we are advising our women to take iron tablets, especially pag malakas. Kasi per nature, the Filipino woman is anemic. Ang usual na hemoglobin level ng Filipino woman is 10 grams. Ano na yan eh? Okay? If you are a global woman, British, etc., malalaki, no? Ang kanilang hemoglobin level is 12. 12 sila. Pero ang Filipino, 10. Kasi nga, our nutrition nga tayo eh. Tayo isang hita kung kumain, okay na, isang hita ng manok. Sa global isang buong manok kanila isang tao lang eh. Dito isang manok, isang barangay. Anemic nga. Nagets nyo? So, our advice, women to women, pag rineregla, take your iron vitamins throughout the duration of your menstruation. Ayun.
Doc, ang lubricant po ba can use as birth control?
Ayun na, nasagot ko na yan, Iho. Okay, meron ako ditong important. At risk po ba ng cancer ang pills? We have already some studies that show na ang pills give you the most problem. The most problem. Okay, I do not want to call it cancer at this point, pero pag nag-pills kasi mas marami kaming problema. That's why even if pills is a favorite among women, we always need to caution. Ito lang pala, my dear nurses, please tell your clients na nagfa-family planning method that they should be examined by a doctor annually whether may naramdaman sila o hindi. Kasi minsan may nakikita na ang doktor na hindi mo pa nakikita o alam. Okay? So these birth control methods can sometimes harm your body. And so, kahit na wala kang nararamdaman, alam ko yung iba ko minsan ganito ha, like, anong isang magagawa ng pills, pag nag-pills ka ng pills, may mayoma ka, nagpipills ka, lalaki lalo. Kasi the pills will increase, the estrogen will increase the size of your myomas. Nagets mo? So please see your doctor, and your method must be SBA must be provided. Hindi yung ikaw lang kumuha kasi effective yun sa kaklase mo o effective yun sa iyong kapitbahay. Marami akong ganyang kaso kasi sinabi nun sa chat group na ganito, gaga ka naman, hindi ka naman na-assess. You have to be assessed first. Make it official para safe ka rin. Okay? Oy, o sige, gutom na ako, my dears. Tapos na ang lesson natin. I'll see you tomorrow. Okay? I'll answer some of the questions again if we have time tomorrow. So I'll see you tomorrow, ladies, with your post-test. We will be discussing the post-test one by one. And again, if there are questions like this, I will be addressing them again. Okay? So thank you very much. Have a good lunch and see you. Bye-bye. Bukas. Thank you.
Thank you, Doc.
Thank you. Thank you.
See you tomorrow po.
Okay.
Thank you, RN. See you tomorrow.